Before we begin the symposium, I would like to introduce some of our esteemed guests in attendance. Please welcome Hong Jae-young, Director General of Environmental Health Bureau at the Korea Ministry of Environment. Song Eun-chul, Director of Citizen Health Bureau in Infectious Disease Control Division. Director Song is representing the Seoul Metropolitan Government. Dr. Akim Ali, Head of Office at WHO Asia Pacific Center for Environment and Health. Dr. Hong Yoon-chul, who serves as both the Executive Committee Chair of the World Health Forum and Director of Seoul Environmental Health Center. Professor Sung-chul Hong, Department of Preventive Medicine at Jeju National University College of Medicine. Professor In-chul Jung, Director of the Gyeonggi-do Environmental Health Center. Yes, he will be joining us soon. Okay, thank you. Now we will commence the symposium by welcoming Mr. Hwang Jae-young, Director General of the Environmental Health Bureau at the Korea Ministry of Environment. Mr. Hwang will be delivering the welcome remarks. Please give Mr. Hwang with a big applause.
Now, I would like to thank Mr. Hong Yoon-chul of the Seoul Environmental Health Center, the World Health City Forum, and WHO Asia Pacific Center for Environment and Health for organizing this event. And it is highly meaningful that we get to discuss this very important topic, and I do believe that this is going to be an important occasion for us to further our discussions about EH indicators. Now, we are setting as priorities in strengthening the capacity for EH indicators at each region. And also, in 2021, we have also amended the related law so that the regional authorities will now be required to come up with their own regional EH plans. Now, to evaluate implementation effectiveness of regional EH, indicators are needed at the regional level, and the Ministry of Environment has conducted research on how to design and use related indicators. The outcome was shared with local authorities to lay the basis for systematically assessing progress of local EH plan execution. Having said that, in terms of the detailed indicators in different fields, we do need to conduct further study to make further improvement, and I do hope that the discussion today will also be helpful and useful in that endeavor. In particular, the EH indicators that we can apply at the regional level, I hope that we can also see good proposals regarding them. And also today we will be sharing the cases of different countries in Asia Pacific, especially in Western Pacific, and I do hope that this can also promote mutual development of our countries. Now, the symposium, I understand, has been organized by the Ministry-supported Seoul Environmental Health Center and the WHO ACE. And the Ministry of Environment designates and operates regional environmental health centers to provide region-specific support in EH policies. In terms of the Seoul Environmental Health Center, now it was designated in 2020. Since then, it has been conducting health monitoring of vulnerable groups and also EH indicator development. And to contribute to strengthening EH capacity in the Asia-Pacific region, we signed an MOU with Seoul City and the WHO Western Pacific Regional Office to establish and support the WHO ACE. Given that today's event has been enabled by collaboration and cooperation among the institutions, I do believe that it is made all the more meaningful. The Ministry of Environment will keep supporting communication and cooperation among EH experts from home and abroad in our policy implementation. I hope we can strengthen our solidarity in environmental health by sharing cases of EH indicators. Once again, I thank all the participants, both online and offline, and I wish everyone good health and good luck. Thank you.
Thank you, Director General Hwang Ding-yeong. Next, I'd like to extend a warm welcome to Mr. Song Eun-chul, Director of the Citizens Health Bureau at the Seoul Metropolitan Government. Let's give Director Song a warm welcome for his opening remarks.
Hello, this is Song Eun-chul, Director of the Infectious Disease Control Division of the Seoul Metropolitan Government. Our Director General of the Citizen Health Bureau was unable to attend today due to the Seoul Metropolitan Council meeting, so I'll be speaking on his behalf. I would like to sincerely congratulate you on the opening of the International Symposium on Environmental Health Indicators. I'd like to express my gratitude to Dr. Hong Eun-chul, Head of the Seoul Environmental Health Center, Dr. Alia Kim, Director of the WHO Asia Pacific Center for Environment and Health, related officials, and environmental health experts at home and abroad for gracing this event with their presence. Thank you very much. Across the world, torrential rain, heavy snowfall, heat waves, and desertification, and other phenomena of climate change are calling for our immediate attention and action. They cannot be and should not be put off as they are our problems. These health damages caused by climate change is gradually escalating, and it is time to take measures and manage them with a sense of urgency. And that is why I think this symposium is even more important. This symposium gathers global environmental health experts to focus on environmental health indicators for responding to climate change by sharing best practices and information from various countries. And I sincerely hope that through this meeting, practical and relevant environmental health indicators will be used by the Seoul Metropolitan Government. Once again, I would like to congratulate you on hosting the International Symposium on Environmental Health Indicators. Thank you very much.
Now, we are honored to have with us today Dr. Kim Ali, the Head of Director for the WHO Asia Pacific Center for Environment and Health. Dr. Kim Ali would deliver the keynote speech on WHO's indicator for environmental health in response to the climate change. Please welcome Dr. Kim Ali with a big round of applause.
Thank you very much. Good morning, and good to see such a big crowd here, and I know there are people online as well. A pleasure to meet you all. It's always exciting to be with environmental health focused folks. If you think back to the days of Hippocrates when the science of medicine started, the environment has always been a key part of how we reflect on how medical science evolved. And just a bit of history with WHO. About 14 years ago, the first resolution from WHO on the impact of environment and health was agreed at the 61st World Health Assembly. And that was such an important resolution because it picked up on all the debates about how the environment and the climate crisis would have sustained and long-term impact on human health if we didn't act quickly and strongly. So I'm very pleased that the WHO in this region decided to pick up that battle. And 5 years ago, with support from the Ministry of Environment and Seoul Metropolitan Government, on behalf of the people and government of Korea overall, agreed to create a WHO Center of Excellence in this region, such that we can act consistently and powerfully on working on all the things that could negatively impact people's health when it comes to the environment and the evolving climate crisis. So I'm really very pleased that the Republic of Korea is supporting that work. And long may that continue. Thank you. I've got a team of people working with me in the center and also collaborating with our colleagues based in Manila at the regional office and in Geneva at the headquarters. Beyond that, of course, are all our collaborators from different governments in the region, academics, and other stakeholders, including other UN organizations. And what our job is could be described in three key ways. We turn science into action by translating it properly, making sure people can actually do something at the front line. We also make sure that our member states can act efficiently and effectively on environmental health issues. And where the capacity is not there, we help them to build the capability and the capacity to do that work. Right at the beginning of our program of work, we focus on air pollution, we focus on water and sanitation, as well as the living environment. But of course, not forgetting climate change. I mention all of that because in this region, this WHO Western Pacific region, the environment and the climate is really extremely important. We've got such a wide landscape in terms of geopolitics, geography, land mass, population size, and all of that has an impact on the burden of disease. We still have countries in the region where we have a lot of vector-borne diseases being very prevalent. We have different bioregions from arid landscape to green, evergreen forest to arid and tundra regions. But also, do you know that we are probably the most advancing in terms of urbanization of all the regions in the world? The economy in this region grew by more than 500% in the last 10 years. And that means we put a lot of pollution in the air. If we don't carefully manage it, we put pollution in the soil, in the water. But also, we have to think about growing sustainably so that we don't actually worsen the climate crisis and degrade the environment in which we work. But also, we have issues about the health system itself, trying to stop the impact of climate crisis, trying to stop the impact of environment on health in a negative way, including food production and all of that. But also it produces its own carbon footprint, which we need to do something about. And I'm also very excited that we have colleagues from the Pacific Island countries joining us at this forum online, because that's another bit of the region that actually showcases the challenges that we have when it comes to the environment and the climate. Just to belabor the point a little bit, air pollution is probably, excuse me, is probably one of the greatest killers that you could imagine, both in terms of direct and indirect effect. But you're also all very familiar with dengue, you're very familiar with leptospirosis, and all the other waterborne diseases that we experience in the region. The key issue is that in this modern century of ours, to still have the challenges around those diseases impacting on people's lives makes it imperative for us to act appropriately. The long-term conditions around cardiovascular diseases also are prevalent and impacted upon by the environment we live in. So yesterday was unbearably hot, 35 Celsius. I struggled, and can you imagine what happens with young children, the elderly, and the infirm, that's people who are unwell, when we have such extreme temperatures? And people do tell me that we don't used to have those kind of extreme temperatures before in this region, and particularly in this city. I'm going to turn now into the specifics about why we are here today. I've said in many ways that the environment and the climate impact on people's health, but those mentioned in terms of direct effect. But there are also indirect effects that we need to think about, particularly how the ecosystem is shifting and what then happens in terms of human and non-human interface. The more interface we have because of deforestation, because of desalination and all of that, salination soil, we got issues around zoonotic diseases and impact on food production. I've mentioned vulnerability and also the health system consideration. So if those are important, we have to find a way to measure the impact of the actions that we take. We have to know how to monitor that we're getting the results that we want from the actions that we take. This is why the indicators that we choose to measure those impacts become very important. And I really must congratulate the Republic of Korea for the legislative environment in which each regional government, each local government is being asked to think about the indicators they're going to choose to monitor the impact of the environment on the population's health. We are here working with Seoul Metropolitan Government to do just that, based on science, based on rigorous debate, but also on practicality. And we are hoping that colleagues from all across, Jonggi-do is here as well today, all across Korea, in all city halls and regional governments, will be able to pick up from the work we're doing here today to also further enhance their work in choosing the indicators that they will need. So with that, I thought I should end by really just mentioning what we need if we're going to effectively monitor and evaluate the work we do on environment and health. Whatever we do, it's got to be comprehensive enough, and it's got to be a tool that is tailored to the needs. You remember we've got various complexity and variations in the region. So what we choose for Seoul will be very different from what we choose for Rarotonga in Cook Islands, or what we choose for Bangkok, even though it's not in this region, but in terms of the WHO region, it's still part of the region, or what we choose for Hanoi, or even Ho Chi Minh. And it's got to be suitable. And to do that, we need the right data, and that data needs to be transformed into actionable insights. So it's not enough to know, it's actually what do we do when we know? How do we use that to act? To turn into practical policies and operational actions by local governments, regional governments, and national governments. So to do that, I would have thought that we've got to monitor a few things. First, the impact of climate on health, the benefits of acting on health and on the environment, the environmental impact, and issues around health system resilience. And more importantly, the cost of not acting, I think, becomes extremely important by measuring both the population cost and the monetary cost in terms of economics. And I'll leave with a word of advice that to choose indicators, we've got to be careful. We've got to make sure that they're relevant. They've got to be practical. We can't really put a burden on governments that already have such a lot to do. Nonetheless, the indicators we choose have to be sensitive to what we want to monitor and measure, and they've got to be specific enough so we know that the actions we took led to those results and we can monitor them over time. Having indicators that are composite, that's multi-layered, is important, but we have to choose those carefully because sometimes with the experience with SDG indicators that are like that, it can be a bit challenging to tease out which bit actually impacts on the environment. And lastly, what you get measured gets done, but you've got to know where you start from. So what's the baseline? Where is the baseline? Where are we starting from? And what's the target? Where are we trying to get to? And so we, at the center, have been looking at the readiness of various countries, and you'll be glad to know that Republic of Korea is moderately ready based on the work you're doing and based on this kind of forum that we put together today to actually look at how we pick indicators that are relevant. I won't go into much details about this. The more technical seminar and discussions will come after that, which would pick up on what I'm just showing on the screen. So, I will finish by saying that we've got to do this in a stepwise approach. And over this year, the WHO Center here in Seoul, working with colleagues across the region, we will try and support as many member states, just as we're doing here in the Republic of Korea, to pick the right indicators to choose to monitor environment and health. And that will be part of the WHO Global Program of Work that will start in the next 2 years. Again, I'm not going to dwell into this. This is just to outline the process that we will take to do this work. A lot of desktop review, modeling, but making sure that it's a low burden approach on member states. And as I said, it's got to be about having clear baseline, clear targets, and meeting needs. So with that, I am going to leave the stand and give you the opportunity to listen to more in-depth and technical review of the work we are doing locally and how this will proceed from where we are after all the technical deliberations to choose the right indicators for our work. Thank you very much, and it's a pleasure being with you here today. Thanks.
Thank you, Dr. Kimali, for your insightful keynote. We will now proceed with the keynote speech by Dr. Yoon-Chol Hong, Director of the Seoul Environmental Health Center. Dr. Hong will be presenting on the topic of Plan for Environmental Health Indicators Embracing Climate Change.
Thank you very much for introduction. And with this opportunity, I'd like to also convey my thanks to all participants online and offline. I think this is a very important moment to think about environmental health indicators, but not just WHO regional, not just Korean country level. We are going to deep down to the local level, what could be the indicator. So my talk would be a little provocative because I respectfully argue against the principle to set the indicators, environmental health indicator from the WHO perspective. It's kind of a world perspective or regional perspective, but I also want to respectfully argue against environmental health indicators set by Ministry of Environment Korea to raise the issue, what would be the principle when we try to set local jurisdiction indicator for environment health, including climate change. So it's I think that the Director Hwang from the Ministry of Environment today said that in year 2020, our Ministry of Environment opened the road to allow local government to set local environment health indicators. But up to now, we don't have such a good local environment health indicators because it's a very much challenging issue. So that's why I would like to take advantage of this opportunity to think about what would be the principle if we want to set local level or provincial level environmental health indicators. I believe that would be different from the country level or national level, and different from regional level and world level. So that is an argument I want to raise today, and hopefully at the end of this symposium we can have a kind of consensus on what would be the really principle when it set local environmental indicators. So my talk is about what would be planned for local environmental indicators, particularly when we try to embrace climate change. So climate change is a really challenging issue. So we need to make a kind of a strategy for tracking and mitigating environmental health impact in the local jurisdiction level. That would be city level or district level or provincial level. But I'd like to start with sharing environmental indicator Korea set by Ministry of Environment. This environmental indicator based on the idea of deep sea. I believe that Dr. Kobaran will talk the deep sea more in later his talk. But deep sea is composed of driving force, pressure, state, exposure, effect, and action. So that is a really beautiful set of the frame to make environmental indicators, and our government, the Ministry of Environment, take this as a baseline to set the environmental indicators. So for the driving force from the deep sea, there are population growth, economic development, technology development, and for the pressure, production, consumption, and waste, the emission, and the state, the factors that place the state of environment under pressure, such as natural hazard, pollution. For exposure, they consider interaction between harmful factors and humans, such as observed dose, external exposure, accumulation pollutants in human body. For the effect, mortality, morbidity is considered. For the action, that would be the policies and social response to counteract the effect, like setting up standards and environmental regulation. So from this framework, our Ministry of the Environment set environmental health indicators, as you see in the right side of the slide. But we are going to talk about local level climate change environmental indicators today. That is, as I argued just before, that would be a little different from the environmental indicators in national level, country level. But the purpose is probably similar. So the purpose is to track environmental hazard, exposure, and health effects, but in the local jurisdictional areas, and evaluate public health intervention effectiveness at the local level. So the key point when it says the local CCEHI, probably that is community-specific environmental and health vulnerabilities. We also consider effective and public health intervention and adaptation strategy for public health to the local jurisdiction areas, and the predicting climate change impact on human health. So that is a key point when you try to set local CCI. I think the local health and environmental department, such as the Seoul metropolitan area, the health bureau, citizen health bureau, they play a pivotal role in these activities as they can provide data and insights that national, regional indicators may miss due to data aggregation issues. So that is another challenging issue. So local data is a little different from the national data. So the local health department activities should have a planning and response to hazard mitigation, and they have monitoring the community health concerns linked to climate change for surveillance, and they develop quantitative measures for environmental risk, health outcomes, and population vulnerability. So when we try to develop the local CCEHI, we need to adapt existing indicators. That would be probably from the national level or the regional or WHO, whatever. So there is existing indicators, and mostly surely WHO, but the government national level try to make a comprehensive environmental health indicators. That is actually their role and purpose. They want to make a comprehensive one. But in the local level, we need to take some of them to adapt such an indicator to tailor to local context. That is a key point. The other one is, we need to establish local indicator to create relevant set of climate CCEHI, and we need to support public health services by enhancing essential services and also integrate climate readiness into current surveillance programs. So that is a contextual framework when we try to develop CCEHI. I would like to also introduce WHO environmental health indicators and their framework and methodology to when they try to environmental health indicators. So there are really a lot of comprehensive list of indicators, but I'd like to share just one case study, that is acute respiratory infection air pollution. They describe this indicator as a major change in the incidence of acute respiratory illness due to air pollution. And that they said the implication for making this indicator is that increased morbidity rate indicate higher exposure and reduced morbidity rate suggests lower exposure. That's why they said this indicator is a childhood morbidity due to acute respiratory illness. Among the deep sea, the area that is about the E effect. So issue is air pollution, and they also the link with health. So that's why they said this indicator, childhood morbidity due to acute respiratory illness. The national rare and role of this indicator is this. This indicator is intended to provide a measure of the effect of the exposure to air pollution in children. As such, it can be used to monitor trends in acute respiratory illness in children in order to help prioritize policy action, to map the distribution of the disease in order to identify areas in need of special action, to help identify specific risk group in order to target intervention, to analyze the relationship between air pollution and respiratory health, and to assess the effectiveness of intervention strategy, such as air pollution control, traffic management, awareness raising campaign. So that is actually background why they want to set this indicator, childhood morbidity due to acute respiratory illness, and that they also describe the linkage with the other indicators and alternative methods and definitions, and the related indicator set, and source of indicator information, source of definition of indicator, underlying definitions and concept, specification of data needed, data sources of verification quality, and computation and others. So this is a framework how they set environmental indicators. So this is one of the examples. I think that really, really nice example we need to follow when we try to set indicators. But even though this is a very nice indicator, there are really comprehensive list of indicators. There are really many, but this is one indicator, and looks very nice. But still, there are challenges and considerations because environmental health indicator is not so simple. It has inherently complexities, so such as a multiple risk factors for acute respiratory disease. For instance, air pollution is not only risk factor. There are many different risk factors for acute respiratory disease. We need to consider that. And there are data limitation and inconsistencies, and differences in health service structure and diagnosis, difficulties in combining statistics from various sources. So there are lots of the issues when we prepare the indicators, when we apply the indicators. So there are a lot of the issues because the indicator has complexities. That means there is no very wonderful indicator to be satisfactory with us. So that is the issue. And so that's why we need to interpret, in this case, mobility measured with caution. We need to consider family history, genetic predisposition, and other environmental factors when we say the child respiratory illness. And we also need to account for unreported cases and classification differences. So even though very nice indicators, there are lots of the issues to consider. So now I'm going to move to Seoul Metropolitan Government effort to prepare the environmental health indicators. We began this work in 2022, 2 years ago. We tried to set comprehensive list of environmental health indicators, like Ministry of Environment, like WHO. But we realized that they may not be right for Seoul Metropolitan Government environmental health indicator. So we had a meeting with relevant department partners, organizations, including Seoul City Citizen Health Bureau and Climate Environment Headquarters, General Safety Department, Seoul Institute of Health and Environment, and Seoul Institute, and Seoul Environmental Health Center. That's my center. So we get together, and also they had another expert to listen to their opinions. We had a lot of talks, and we tried to find the governance structure to set the indicators, because each body of the related to Seoul Metropolitan Government has their own mission, their own interests, and they argue that if we have such an indicator, how can monitor that? How can we to make this realistic indicator? There are lots of issues among the parties in the meeting. So we actually had a complete list that is around 40 environmental indicators. But finally, we had 6 indicators. And you may think that from the 40 to 6 is a too small number of indicators, but we still think 6 environmental indicators is kind of too much to follow, to monitor, to track changes. So there are a lot of issues. So I'd like to share the 6 environmental health indicators we had a consensus to set in the Seoul Metropolitan Government. There are 4 categories. There is a carcinogen, environmental hormones, air pollution, climate change, noise. And the 6 items, that is lead, environmental hormones, ultrafine dust, ozone, heat wave and cold spell, and noise. So for 6 items, and each item we had 1 indicator. So for instance, lead, to promote mental health of children and adolescents by reducing lead exposure, we set the indicator as a reduction in the percentage of biological lead concentration exceeding a certain concentration in children and adolescents. That is actually 10% reduction over 5 years. That is our goal for this indicator. The other one, for instance, the environmental hormones. To promote children's health by reducing exposure to environmental hormones, we set indicator as a reduction in percentage exceeding the standard for silage, including environmental safety management standard for children's activity space. So that is actually 10% reduction over 5 years. And so on. So we had such 6 indicators that should set a specific goals. And because this is only 6 indicators from the beginning 40, so at the beginning people say, 6 is okay. But if you look at each indicator, every indicator has a challenging issues. So 10% reduction over 5 years over red level in the children may not be easy, right? So that is actually the issue that we face when it's set local environmental health indicators. But today's issue actually is more about climate change. We only have one, heat wave and cold spell, to protect the health of Seoul citizens due to climate change. We actually set the indicator expansion rate, heat wave, cold spell, response policy, that is a 30% increase over 5 years, such as the message notification when there is a heat wave. Yesterday, 35 Celsius, right? So in the case, there could be some message. And we set 30% increase of message sending for 5 years. Does it make sense? So there are really challenging issues. But what could be the better indicator in the heat wave and cold spell or other climate change issues? But that is actually the main, one of the main topics today, right? So I'd like to ask you, all of the participants, what would be really good climate change indicators in the local jurisdiction, for instance, Seoul? It seems easy, but actually it's not so easy. But we said why we have already a lot of discussion about the local climate change related environmental indicators. We had a kind of principle that is we should have a consensus-based decision. Second, there should be science-based evidence. And we need to consider practical way and realistic way. And there should be available intervention to monitor intervention impact. So that is a kind of a principle. And so now today, considering all of these principles, we had internally, when I say internally, that is a Seoul Environmental Center. Internally, we try to propose 2 indicators. That is a preterm birth during summer months in district level or Seoul jurisdiction. The second one is number of disabled people suffered by climate change related events such as disaster, flooding, or heavy rainfall, such as things. But so I really want to raise this issue and to ask you, what would be the proper climate change related local environmental health indicators, particularly when you think about Seoul metropolitan government or if you think about your jurisdiction areas, what would be such a local environmental indicators about climate change? So that is actually a question to you. So I really want to get clear answer from your part before ending of this symposium today. And to prepare local CCEHI, we need to consider the local data collection and reporting system, and we need to foster collaboration between local health department and national agencies. That's also important. Beautifully, we have a collaboration between Seoul and the national level Ministry of Health, and even WHO. So this is a very much important collaboration, and we need to develop training program for accurate data interpretation and promote public awareness and community engagement. So that is my slide presentation. Thank you very much.
Thank you, Dr. Hong, for your valuable insights and experiences with us. Now we are going to take a 15 minutes of break, and then we are going to take the photo. So we would like to invite all the speakers and esteemed guests to join us on the stage for group photo to commemorate this event. So please follow our step, and for those in the audience, please feel free to enjoy the coffee break. The coffee table is located at the entrance of the venue. 잠시 한국어로 안내 말씀드리겠습니다. 그 커피는 오늘 다회용기로 준비가 되어 있습니다. 그래서 커피를 드시고 오후에 또 커피 브레이크가 또 있기 때문에 쓰신 다회용기를 오후까지 계속 사용하시거나 가지고 오신 텀블러를 이용해 주시면 감사하겠습니다. Welcome back, everyone. I think a few of them are still not coming yet, but we need to stay on time. So we hope you had a pleasant coffee break and networking with other attendees. The next session is experiences on national level indicators from the Western Pacific region. Our chair for this session today is Dr. Milan Tondu, Technical Officer from the WHO Climate Change and Health Unit. Please join me in giving Milan Tondu a warm welcome.
Great. Good morning, everybody. My name is Dr. Tondu. I work for the WHO ACE Center here in Seoul. Like many people, I love Seoul. My favorite sentence here is "조금 men," little spicy. So thank you very much for the partners and collaborators for organizing this event. It's been a great couple of months coming up with the themes and making sure that we are able to cover the topic. The presentations this morning were very good, with Akim Ali setting the stage and Professor Hong really making us see the practical experience behind building those indicators. So for this session one, what we will talk about is really what are the experiences at national level and how these indicators at national level were set in the region. As you know, as per WHO region, there's 37 countries, so we are only going to present today 4, so Australia, Japan, Singapore, and Korea. We have 4 speakers, 4 of which will be online, plus our presentation from Korea, who will be here in person. Without further ado, I would like to introduce our first keynote speaker, who is Professor Todd Court. He works at the Yale Center for Business and Environment, but he has also done a lot of work under Technical and Scientific Advisory Board. He advises the World Health City Forum on the development of climate and health resilient cities. He has a background in civil and engineering, environmental engineering. So over to you, Dr. Todd Court. You can take the screen.
Can you hear me okay?
Maybe we can add a little bit of volume here, but we can hear you. You
I
can
can
go
speak
ahead.
a little louder, so hopefully that will help. So thank you. Good morning to you, and a very late good evening to me. It was fascinating to listen to the previous keynote because we're talking about indicators for climate change, and heat events came up as a key indicator. And that is what is happening right now where I live. We have record-breaking heat here in the Northeast United States. It is the earliest we have ever had temperatures of this magnitude here in this region. And so it's a very relevant conversation here in the United States and abroad. As Dr. Tondu said, I am a professor at the Yale School of Management. My background is in engineering, but I teach finance. And what I want to talk about today is really at the juxtaposition of these two topic areas between environmental indicators and finance. Because what I've been working on with the World Health City Forum is to create a smart health city standard. So I want to talk to you about the process that we are undertaking in order to develop that smart health city standard. And I want to end with an invitation to all of you to join this process. We're starting here in Seoul, in Korea, but the intent is for this to be a globally applicable standard that cities can use to better prepare for climate resilience and health resilience in the future. So I'll walk you through the standard, and then I'll yield the floor to others, and I'll stay for the panel in case there are additional questions afterwards. So everyone knows this already. You've already seen this kind of data. You've talked about it already this morning. But it's it's critical that cities become more resilient in terms of climate and health. For a number of reasons, but cities are the main engine today of economic, social, and technological development. Most of the resilience that we talk about is occurring in cities, and yet we're lagging significantly behind the threats and the risks of climate change. So we have these acute challenges because of the historic legacies of energy use, of the intensity of energy use, of the insufficient investment into infrastructure, and in particular demographic changes within cities. Cities are getting bigger. There's not enough finance to build resilient infrastructure in them. And we have exponentially increasing threats from climate change that are impacting on cities, which is having ramifications on the cities themselves, but also on the suburban and rural landscape around cities today. So why do we need a new standard? There's several reasons. And I should mention that everyone here in the audience probably knows that there's a lot of standards out there today on sustainable cities, resilient cities, climate resilient cities, etc. So why a new standard? One reason is that the risks that we are talking about are accelerating and evolving. And many of the standards are already outdated in terms of health and climate resilience. And so it's important that we keep up with these challenges. And I think that message came across in the last talk where we talked about the need for evolving metrics and indicators for climate resilience in urban landscapes. A second reason is that there's a huge need for integrating the environmental indicators along with financial indicators of investment and financial resilience, and also with smart city indicators. Because today, the most resilient cities are the cities that will be the smartest in terms of technology and integration with the global economy. So we need to bring finance, smart city technology into this question or this conversation of environmental resilience. A third reason is really a call to action that these standards that are out today have not produced a great amount of data collection or harmonization of indicators. So we really need to trigger this and push this forward because the data today is already outdated in many ways. So we want to integrate best practices from around the standards universe, bring them together into a smart city standard, and try to move this ball forward. And really what we like to do in the smart cities standard is to focus on building integrated systems that will occur in the short term rather than looking at the long term, kind of 30, 40 years out. So just to talk about the process a little bit, the first step we've done over the last 3 months or so was to look at the principles of the Smart Health City Standard and the World Health City Forum. So there was the Incheon Declaration, which many or all of you are already familiar with, that was adopted in November of 2023. And there are 3 principles that we are using from that declaration to develop the standard. So the first is engagement. We want to actively involve stakeholders from across the urban landscape and the national landscape, whether that is civil society members or government members, national politicians or city leaders, also businesses from both the public and private sector, so hospitals, health centers, financial institutions, infrastructure businesses, etc. So we want to engage actively across the standard setting, but also integrate that engagement into the standard itself. The second principle from the Incheon Declaration was materiality. So we understand that the nature of the risk is going to be different for different cities. The nature of climate risk in Houston, Texas is very different than in Singapore. And so cities need to determine what are the most material climate and health risks to their cities while also being consistent with cities around them and around the world. And then the final principle is data. We need more data. We need better data in order to make better decisions. And so we're very focused on, as we develop the standard, that we're going to create metrics that will assess the performance of the city and the future ability of the city to rebound from climate events in real time. So based on these three principles, we went through the process of looking at most of the current standards that are available that touch on this topic of climate resilience and within cities. So many of you will have been involved in these standards, or you'll have read them, or perhaps you're beginning to use them. But there's standards now from the World Health Organization, from South Korea and the Ministry of Health and Well-being. The Asian Development Bank has a standard. The European Bank for Reconstruction and Development has a standard. There's the C40 cities standard. There's a lot of standards out there right now, and we reviewed dozens of them. And a few lessons came out from this analysis. The first is that there's very little consistency in what the standards call for, but there's a lot of consistency in this idea of dimensions or themes. So most standards use a theme of something like people, planet, and profit. Something around social, environmental, and either governance or financial aspects. But the integration can be very, very difficult, and the indicators that sit within those pillars are very, very different across standards. A second consistency we see is around citizen consultation and stakeholder engagement. So again, we want to continue that idea of engagement and determining a materiality is important to this standard as well. It's something that has to come forward from all the standards that we have. The second lesson that we learned is that while there are a lot of indicators across these standards, there's actually room to improve, particularly on the smart city indicator and the financial indicators. So financial indicators in particular look at what is the financial impact of climate change events on a city. What we're more interested in today is what is the financial resilience of a city to invest in infrastructure before the event happens? And what does that investment look like? We're also interested in the financial indicators of connectivity between a city and the global economy, because cities that are more connected to the global economy tend to have higher financial resilience. Under the smart city banner, we're looking at technology integration. Things like, do you have access to Wi-Fi? Is it reasonably priced? Is it resilient to shutdowns or electricity shortcomings? So integration of technology within the city, both in terms of access and in terms of data sharing, is really a room for improvement within the standards today. A third lesson is that the amount of data that is sourced and reported today varies significantly across the standards and across cities. So it's very important that we arrive at a consistent way of analyzing and reporting data, because right now it's very difficult to compare resilience between cities based on the data that we have. And then final note or lesson that we learned from the review of these standards is that a lot of the metrics that we collect for a resilient city is actually the country level. So we're actually measuring national resilience, and we're extrapolating that to a city to try and understand resilience. And sometimes that works, but a lot of times that extrapolation does not work very well. So, as I mentioned, we are in the process of drafting the standard now, and this is just a sample of what the structure looks like. I did not list all the indicators that we have so far. It would be a long list. I just wanted to give a little snapshot. So we have right now a structure of topic indicators, and these will look familiar. There's health and well-being, which is a social indicator. There's sustainability and resilience, there's governance, and of course the smart city indicator. Within each of these, there's a set of topic areas. So I've pulled out Smart City as an example of one of those topic areas. Within Smart City, we've identified digital infrastructure, smart payments and finance, as well as connectivity and global links for the city. And then within each of those topic areas, there's a number of indicators that we've started with. So again, just examples. Under digital infrastructure, we would measure things like internet quality, internet accessibility, affordability, security of internet protocols, access and use of 5G and AI. And then finally, for each indicator, there will be a set of metrics, whether that's upload or download speed for internet quality, or how many people are covered by a mobile network as a measure of internet accessibility, etc. So this is just a sample of the structure. And the reason I wanted to present this is because I actually want you to engage with us to help us make this structure better. And I'll talk about that at the very end here in just a couple of minutes. So as mentioned in many of the other standards and in the Smart City standard, we think it's very important to engage with stakeholders. We also think it's very important that stakeholders are central to the implementation of the standard. So we've gone through the process of identifying key stakeholders. These are the big groups. There's lots of smaller groups within each of these. But again, city officials, municipal, national governments, different sectors of the economy, from public utilities to financial institutions to health institutions. There's a number of different stakeholders that are going to be important, not just to learn what the indicators should be, but then to collect the indicators, collect the data, and integrate that data into the assessment of resilience. So this is my last slide. I want to show you the process that we are undertaking right now and invite you to join us in any number of different capacities. So we are on the cusp of sending out a survey to hundreds of stakeholders. We would love for you to be on that list. So if you would like to participate in the survey, we would love to, find your email address and send you out the survey when it goes out, which will be very soon. We're also this summer, we'll be doing workshops, some similar to this, where we'll be presenting the process of the standard setting, some more interactive, where people have the chance to feedback, look at the details of the standard and give us notes and comments. Our goal is to draft the first version of the standard in the fall of this year. So that would be starting in September, so that we can launch the first version of the standard in November at the next World Health City Forum. So that would be November of 2024. And then, of course, we'll iterate on this into the winter of 2024 and then beyond. If you can participate in the survey, that would be wonderful. If we can collect your email address, or if you volunteer. If you'd like to join a workshop, I would love to see you at these. Ideally, even in person, if I can make it out to wherever you live. We will be forming an advisory group. It will be purely remote, and very low lift, not a lot of time asked. We would love for people to join the advisory group if it's appropriate. And we're looking for financial sponsorship for the standard development. So if you are in a company, for example, a public utility or a financial company or a healthcare company, these sorts of standards are very important for you in the way that you're planning with city governments. And it makes sense for you to engage with the process of the standard setting that cities may well adopt. So we encourage you to support us and to become part of this process. So with that, I will end. You are certainly free to email me directly if you have questions. If you'd like to take part, this is my email address. But you can also reach out to any of the folks at the World Health City Forum, and they can connect us. So thank you for the time. I think I'm right on time, and I will stop there.
Thank you very much. Yes, you were. Thank you for this excellent presentation. And just presenting this exciting piece of work about creating a smart health city standard. And yeah, we will take you up on the action. Thank you as well for bringing to our attention the importance of updating the new standards, the old standards, the importance of integrating environmental indicators with financial indicators and smart indicators, and really exposing how smart city standards are a real opportunity for us to deal with the challenges regarding environment, health, and climate change. So I will now move on to the second set of speakers. We have today the director and deputy director of the WHO Collaborating Center for Climate Change and Health Impact Assessment based in Australia. They will be splitting their presentation. First, I would like to introduce Dr. Ivan Hannigan. He's the director of the center. He has collaborated with a wide range of experts on international but also Australian projects, particularly the HEAL project. He has been working with the Australian National Network, and he has also been leading a number of very high-level work with the Lancet and also with Southeast Asian projects around fire smokes and other climate change pathways. The second speaker is Aditya Vyas. He is the deputy director. He is also very high profile with a background in public health. He has worked a lot with WHO as a consultant, but he currently also holds senior leadership roles at Ministry of Health, working as well at the University of Canberra, and he's a fellow of the Australasian Faculty of Public Health Medicine. Over to you, Ivan and Adi. Thank you very much for being here.
Thank you, Milan, and thank you for that introduction. It's great to be here. This is a really important symposium on environmental health indicators, not only to monitor and evaluate the impacts, but also to support action and decision making. As Milan said, this is an Australian-focused talk, and we're very excited to bring you a case study that we developed across the states, as Australia is a federated country of states, but also has currently been started as a national project now. It was great to see the deep sea framework explained and explored this morning. We picked this up because of its international prominence and its very useful nature, as the history of it goes back so far. However, it has been modified and updated, and you can see that in the UK there was additions of the context which explains indicators of vulnerability, and then community and adaptive capacity out there on the right-hand side. These are very important aspects that are sitting around the driving pressure, state, exposure and context levels. So the states that we worked with were the Victorian state in the southeast at the bottom of Australia, and New South Wales in the middle of the east coast. And as you can see down the bottom in yellow, it is now the Australian Institute of Health and Welfare's chosen method for the National Environmental Health Indicator Project starting this year. Now, just to go around the circle, in this case study, we've picked out the indicator of driving force is really around the choices that our cities make for transport and housing, which puts pressure on the environment. Some indicators are the colour of our roofs and the amount of green space or vegetation. This affects heat waves in the urban heat island, which we are exposed to as heat waves during heat waves. And in the context of our populations, their age and their burden of disease can then lead us to indicators of the effect. The attributable mortality was the one we chose. And hopefully we can draw a link now through this to indicators of action, which we'll talk about as well. But this wasn't the only hazard that we were tasked with tracking in this major project that we completed a couple of years ago just for the state of New South Wales. And it goes through a process of co-design where the selection of those particular hazards was created with the Ministry of Health and the Department of Planning and Environment, along with a range of academics. We held workshops and it was very collaborative. And then there was a literature review for each of these risk outcome pairs, which were selected as indicators of broader health and wellbeing issues related to these. Not all of these had very strong evidence of health effects. So ranking them in order, the most strong was air pollution. And you can see across the top, we were also tasked with looking at indicators from across the deep sea framework. However, we really had to focus our efforts because of resources and data availability. We were able to look at indicators for all of the health effects, but only the majority of exposures and virtually no driving forces in this particular case. And that's a area of urgent need. But to show you how it's done, this is the case study of urban heat in the city of Sydney. And what we can see here is the ability of the framework to drill down into parts of cities and look at subpopulations at risk. And we used great available data on climate and weather and over decades. We were able to do this as a large report, but also drill into each of the particular issues and publish papers in journals such as this one, where we really took this one as the health impact assessment of the focus. What we did in this particular study was look at the urban heat island effect and the amount of green space and vegetation and other things that we were concerned about, particularly black roofs. You can see in this high resolution map going down to hundreds of meters, we were able to look at the variability of the urban heat island and the mitigating adaptation of changing the roofs and the green space. We did scenario assessment out to 2,100 of the heatwave impacts using the RCP 8.5 scenario alone, and this is an important and complicated area of using indicators. You have to decide what will be done to compare. Will we get a 8.5 future, or could we achieve something lower like the 4 or the 2.5? These are linked to global warming levels. So we had all this data and we could look in the present at the heatwave impact in Sydney. And that's the grey line with the uncertainty bounds around it. So every year, using epidemiological attributable fractions, we estimated the deaths. We were able with this data to actually do a counterfactual scenario where we removed the urban heat island. And that is the red line. And if the urban heat island was completely removed, we would have very much fewer deaths now and, importantly, in the future. So this paper has led to a public policy discussion around the country, and there are currently actions, really important bans on black roofs in some of our states and local government areas asking for a blanket ban on these dark roofs which are driving the urban heat island. So I'm going to pass over the baton to my colleague, Dr. Aditya Vyas, who's going to say a bit more about how we scale up from this state and city-based analysis to national work that is currently going on in Australia. Over to you, Adi.
Thank you very much indeed, Ivan and Emilian, for that kind introduction and for having us at this important conference. Friends, I'm a public health physician by training, meaning that I've worked predominantly on the public health practice side of things within ministries of health, local health systems such as public health units, which we have distributed around Australia, and of course in the Pacific and in the Western Pacific more generally. But the way that Ivan and I come together is to say we have this excellent environmental health indicators technique and complex epidemiological methodology. How do we translate that science into research and into policy practice? So you see here on the screen 3 examples of how this highly technical and important work that Ivan's put together can be translated, or has been translated, in fact. So firstly, on the left-hand side, you see the Environmental Health Indicators report that Ivan and his colleagues previously at the University of Sydney prepared for us when I was the Director of Environmental Health at the New South Wales Ministry of Health in Sydney. And we were able to use that to, in fact, inform the Minister of Health, our Chief Health Officer, around some of the more proactive surveillance that can be done on the key environmental health issues facing our population. Remembering that the populations in Australia are rather small in comparison to the rest of the Western Pacific, so something like 8 million people is what we were looking after through our Ministry of Health. However, more recently, Ivan and colleagues have informed the AIHW, the middle report you see here, which is the Australian Institute of Health and Welfare. And this is a bit of a landmark report, I must say, and it's only fresh. It's been introduced a few weeks ago, but really it sets the scene and it sets the tone for how Australia nationally might be looking at environmental health indicators in the context of climate change. I would encourage you to have a look at that, but many of you will be happy to see that the deep sea method is strongly reflected there, and there'll be more work to come from this process. On the right-hand side, you see another very important landmark event that occurred for Australia late last year. In December 2023, our Assistant Minister for Health launched the National Health and Climate Strategy for Australia for the very first time. And importantly, this is an action-oriented strategy. There's something like 50 actions that will be implemented both nationally and at the state and territory jurisdictional level, as well as by local councils, local hospitals, and local health systems. So Ivan and I are part of that. And one of the key things is to translate this methodology into a set of guidelines where health services, health practitioners can make evidence-informed risk assessments for their local population, as well as their local health services. Next slide, please. And this is my final of the 2 slides, to point out that there are both international as well as national collaborations. Ivan and I are both part of the Medical Journal of Australia's collaboration with the International Lancet Countdown. Many of you will be familiar with the countdown to 2030, which is intended to measure 5 domains of indicators for health and climate change. And importantly, or perhaps uniquely, in Australia, we set up this process some 6 years ago, and we've been producing reports every single year. Now, that's done 2 things. Firstly, it's informed the public health decision makers and the health policy makers on what the key areas of impact as well as action can be. But a secondary effect of this is that we now have a wealth of evidence on which to base these decisions. I don't think we can discount that. And in fact, there's often a hunger and an appetite for showing us the evidence before we can take action, the precautionary principle notwithstanding. So these are just some examples that I've been happy to share with you today about our work, which translates research into policy action. Back to you, Ivan, perhaps for the last slide.
Thank you, Adam. You can tell this doesn't happen in a silo. We have a huge range of collaborators and we pay acknowledgement to them here. Thank you for having us.
Great. Thank you very much. Great combination of presentation here. Thank you very much, Ivan and Adi, for covering really the details around collaboration and co-design when it comes to conducting such complex work. All of the what I found particularly interesting was this prioritization of the indicators based on the highest health risks. And I'm really going to trigger you to ask some questions at the end and thank the speakers for staying until the panel. We also have this afternoon Carlos Carvalhan, who will speak on the indicators, and he was one of the important thinkers around the deep sea framework. And we know that now, everybody's been mentioning it since this morning, that this is really going to be important for us to translate science into action and to understand the areas of impact and action, as Adi just told us. Just a quick one before we move on to Professor Masahiro Hashizume, who is a very long-standing collaborator with WHO, but with a number of universities in the region. I quickly checked the urban heat island effects in Seoul, and because of the Seoul forests, I found a study from 2023 showing that the cooling effect of the forests in the city can decrease by nearly 2 degrees in a surface of 3 kilometers. So I really wanted to commend the Seoul city and the metropolitan government about, making these forests very accessible. I personally enjoyed it a lot. So, moving on now to Masahiro Hashizume. Welcome, Professor. He's a very distinguished professor at the Graduate School of Medicine at the University of Tokyo. He also has a background in medicine as a physician and a very renowned environmental epidemiologist. He has worked on different climate change exposure pathways. He has been trained in London at LSHTM, and he has served as a lead author on the IPCC 6th Assessment Report. Welcome and thank you, Professor Masahiro, for being with us today. Over to you.
Thank you, Milan. I'm very happy to be here today. And so my talk will be the health impact assessment of climate change and adaptation measures, specifically for heat-related risks in Japan. Yeah. Okay, so in 2018, the Japanese government enacted the Climate Change Adaptation Act and has developed the National Adaptation Plan. And all the municipalities, local municipalities, have to develop the climate change adaptation plans in each municipality. Then according to the Act, the Ministry of Environment has committed to the publishing the climate change impact assessment reports, not only for health, but also other sectors, including agriculture, water, ecosystem, or natural disasters. And actually, even before the Climate Change Adaptation Act, in the first edition was published in 2015, and every five years, this assessment report has to be, revised. So at this moment, the next year, the third edition will be published. Then I have been chairing the health working groups to summarize the impact assessment in that report. So we have used three indicators to assess the health impacts, which are the significance, urgency, and confidence. Then these health indicators or category have been picked out. One is heat-related illness, or cold-related death, waterborne and foodborne diseases, vector-borne diseases, and complex impacts of air pollution and temperature rise. So for heat-related illness, all the indicators were assessed as high, both all significance, urgency, and confidence. For waterborne and foodborne, it's a medium levels, and also the interaction between air pollution and temperature rise are also assessed as medium levels. For vector-borne disease, assessed as high for significance and urgency. So at this moment, I think the top priority for Japanese government is the heat-related illness. It's a high national priority in Japan. In addition to the heat-related illness, yes, has been increased over time, as you can see in the left panel. Approximately 70,000 ambulance transport has been occurred in the last 5 years. But deaths from heat stroke, there is an obvious increasing trend, and approximately 1,300 deaths due to heat stroke occurred every year in the last 5 years. And 80% of them are older population, above 65 years old. And the future projections, compared to the base period in 1980 to 2000, if you follow the RCP 2.6, which is almost a 2-degree scenarios, in the mid-century, 2030 to 2050, the number of ambulance transport will be increased by 1.7 times. And if you follow RCP 8.5, 4 to 5 degree scenarios, at the end of the century, it will be 4.5 times, with regional variations. So, this moment, Japanese government implemented the adaptation measures for heat-related risks. For example, as a soft measures, heat stroke warning system, so-called heat stroke alert, Japan. As a hard measures, promoting proper use of air conditioners, like subscription service for air conditioners, or supporting the installation of air conditioners and emergency power supply in schools, social and support facilities. At the local or regional level, they are preparing the cooling centers for citizens, or so-called cooling oasis or cool shelters. Right. And also improving land surface through the cleaning and the use of water in the public places. So action plan for heat stroke prevention was launched in 2021 and revised in March 22nd. And this plan outlined the priority measure against heat stroke, especially for older population. And the government set the midterm goal by 2030, aiming at a 50% reduction in the number of deaths due to heat stroke from the current levels. To achieve that, as one of the measures, as I mentioned, the Japanese government launched heat stroke alert system in 2020 in the Kanto region, which is near Tokyo. And it was expanded nationwide in 2021, 3 years ago. An alert issued when the daily maximum WBGT, wet bulb growth temperature, is predicted 33 degrees or higher. And it's announced at 5 p.m. on the previous day and 5 a.m. In the morning on the same day. And if you register, you can receive the email about the warning alert messages. So, so Japan has been, well known as a super age society with more than 90% of residents living in urban areas. And this accentuates Japan's vulnerability to climate change related health risks, particularly for extreme heat. and adaptation measures has been implemented at national and local levels. However, little is known about the effectiveness. For example, the effectiveness of heat alert system has not been assessed yet. So systematic assessment is needed to monitor and maximize the effectiveness, which can support science-based policy making. And to respond to climate-related health emergencies, especially Japan, it's well known that a lot of the natural disasters, including heat waves, typhoons, and earthquakes. And so it is necessary to adopt a comprehensive all-hazards approach to health crisis management, and it requires collaboration and communication among multiple stakeholders. Okay, thank you very much. Many of my presentation slides was prepared by Dr. Yuni Kim and Dr. Kazutaka Oka, National Institute of Environmental Studies. That's it. Thank you.
Thank you very much, Professor Hashizume, for this excellent presentation. I mean, I think if we're thinking about the comparison between what was explained about Australia and now Japan, I find both of them very ambitious. I mean, now Professor Hashizume is telling us that they're aiming for a 50% reduction in heat stroke over the next 10 years, which means that this is a real priority, and that is something that you share with the Korean agenda. I found that very, very interesting. Maybe the second thing I would like to highlight and thank Professor Hashizume is also talking about the co-benefits without saying it particularly. The example around heat stroke ambulance transport, he mentioned greening, green cleaning, use of water, and I think we will get more into this as we continue the day thinking about all the different important actions to be done across sectors. Thank you very much. Keep writing your questions down for the discussion. I'm really looking forward to that. Let's move on now to Singapore. We have today Dr. Abhiyasinge Rabindra. We call him Dr. Rabi, but he brings to the table today a wealth of experience from having been previously the WHO representative in the Philippines. Today he is the WHO representative for Malaysia, Brunei Darussalam, and Singapore. He has a long-standing position in WHO and beyond as a coordinator for a number of vector-borne and parasitic diseases. He is an expert in looking at how these diseases evolve. Right now, Dr. Rabi is joining us from Malaysia, I believe, so over to you, and thank you so, so much for being with us today. Dr. Rabi, can we test? I think we can't hear you yet. Dr. Rabi, can you hear us? Okay, you can hear us, but we can't hear you yet. I'm sure Linda is on it. Thank you very, very much for your patience. Let's see what we can do.
Apology.
Great. Now we can hear you. Test 1, 2, 3.
1, 2, 3. I hear you. Thank you.
Excellent. Over to you. You may share your screen, Dr. Rabi.
Can you see my screen now?
Positive, yes.
Thank you. So, I'm going to use the example of Singapore's efforts at ensuring environmental hygiene and standards. Before I start, I want to actually acknowledge Professor Masahiro Hazusumi, together with whom I did some work previously, and it's a real pleasure to see him here. So the example of Singapore, I'm going to talk of the work of the National Environmental Agency, which is the leading public health organization for ensuring clean and sustainable environment in Singapore. The NEA has 5 areas of work. They are responsible for environmental surveillance, ensuring indoor air quality, monitoring zoonotic diseases, mosquito-borne diseases, and chemical pollutants. And for the sake of this meeting, I'm going to be talking on environmental surveillance. And from the environmental surveillance aspects, I'm going to talk especially on Singapore's efforts at ensuring air quality. The air quality in Singapore has generally been good over many years, although the nationally determined levels or thresholds are still below the standards set by WHO in its 2021 air quality guidelines revisions. What is interesting about Singapore's efforts and the NEA's efforts is, for those of you who, and I believe most of you have been in Singapore, it's a densely populated state of over 5 million people. And so the variations in air quality and being able to detect that is important. And because of Singapore's geographical location, they seem to have periods of significant deterioration in air quality, which is largely driven by fires happening for agricultural purposes, so-called slash and burn, in preparation for the cultivation seasons transnationally in their neighboring countries. And so Singapore has been challenged on how best they can use air quality monitoring from a preventative promotive perspective. And to do that, they needed to ensure that they have the capacity to monitor air quality in multiple locations across the island state or the city state. And they wanted to generate data and transmit that data in layman's terms, in terms understandable to the population. So not in the PM 2.5, PM 10, nitrous oxide, sulfur, because for the population, what does that mean? So they came up with a composite indicator, and they used a locally adapted system to monitor the air quality, which is a relatively cheaper adaptation of the more complex technology, but they also back that up by using satellite technology. And this combination helps the NEA to generate real-time information, which they then put up on their website, which is available at 1-hourly intervals and over a 24-hour period, which helps to give access to that information to the general public. And the beauty of it is that they have transcribe the data into a publicly understandable indicator by bringing that together. So if you want to see the air quality, you can go to the website and see it. But they also have this composite indicator, which brings together a color-coded information system, which the population has got used to. And they may not know what are the underlying technical characteristics or details that underpin this, but the information is adequate enough for them to know what do they need to do so that they can work effectively, so that they can enjoy life as much as possible in a normal way. What precautions do they need to take depending on what band of air qualities are available. So I think this is something which is very encouraging, which we would like to see other countries also adopt, because it's one thing to have a scientific monitoring of the information, but being able to translate that to a population understandable indicator and linking that to what do you need to do to protect yourself, your family, your pets, what can you do, how good is it to go out, etc., etc., is tremendously useful. And this is what I actually wanted to present today, because we think that that is a very novel approach that can be used, and it then creates the awareness about air quality among in people, and it uses that air quality not just for monitoring purposes, but it actually contributes and empowers the people to make decisions on how best they can function and what's best for their health and security. So I think this is what is good about the Singapore experience, which I wanted to present to you today. Thank you.
Thank you so much, Dr. Rabi. Excellent snapshot of this very big work, which is to make the indicators digestible. It's nearly lunch, but not yet. But I think a lot of these national level indicators are very challenging to communicate and to be able to translate into what you are calling codes for it to be publicly understandable. So I would like to thank the online speakers right now. If we can just show the snapshot of them online. The presentations have been excellent. Thank you for putting so much effort. We would like to ask you to stay until the panel discussion. And we have now a speaker who will be here face to face. This is our last case sharing for the day. I would like to invite Dr. Ji Yong Kim. She is currently the Director of Environmental Health Policy Division at the Ministry of Environment. She's a very precious and esteemed colleague, and I would like her to come on stage. Thank you.
안녕하세요. Good morning. I am Director of Environmental Policy from the Ministry of Environment. For quite a long time, the environmental health indicators and climate change related health areas have been a very important topic. And I know that I was actually coming here to just listen to these experts from these different fields, but then I wanted to use this opportunity to perhaps introduce the case from Korea. Especially I wanted to share this information with the audience and also people joining from different parts of the world. So this is the overview of my presentation. As for our indicators, what's the objective of developing these environmental health indicators? And as was mentioned by other participants, we're here to measure and assess the environmental health conditions of the people. So this is based on Article 21 of the Environmental Health Act, that the Minister of the Environment shall develop indices for measuring and assessing the environmental health condition of the people. This act was developed in 2008. I believe that Korea was the first country to ever have developed the Environmental Health Act in the world back then in 2008. So from 2007 till about 8 to 9 years, we have developed Korean environmental health indicators based on the previously mentioned model, Deep Sea model. So this has been done by different institutions involved for environment and health, and we've been producing and analyzing our indicators every year from 2016 to 2019, and we had published a fact sheet from 2020, and we have been publishing them every 2 years. When you go to the MOE site, you can get the resources. And I actually downloaded 2022 fact sheet. It was about 300-page long document. Yesterday, I had a chance to attend another meeting. And in 2004, there was a study on climate change, what type of an impact that it would have on health. And I was able to meet one of the authors of that research. And I just realized that it's been 20 years since then. So the expert was saying that in 2004, we were looking at additional number of deaths as a result of climate change. But back then, when we came up with the number, people were quite surprised to see such a significant number being published. But then the actual reality points to an upward trend. So I believe what we're doing right now will be very critically important for future generations. So this is page 3. I think this was already shared by Dr. Hong during his keynote speech. So rather than going into that, I will focus more on examples. There are 28 health indicators across 5 different sectors. There are total 128 sub-indicators in detail. So we have 128 indicators for air quality and pollutants. There are 18 different indicators, air pollutant emissions, and it is done by substance and by region and by sector. And as for chemical materials, we look at the distribution and also the emission of the chemical materials. That is a high-level indicator, but then we will look at the volume of distribution and discharge chemicals, manufacturing volume, import volume, usage, environmentally hazardous emissions, and so forth, and self-landfill volume as well. Since we're talking about climate change today, we have an indicator for climate change. We have GIR, which is a greenhouse inventory system, which is announced every year, and it is submitted to the UN. The relevant information was actually adopted as a detailed indicator. So that was related to the greenhouse gas emissions. So next is when we're doing the environmental health indicators, actually this portion is going to be presented by Jung Da-eun, our next speaker. So this is going to be a bridge presentation leading into that next presentation. We came up with the National Adaptation Plan. We understand that this planning process would have been quite burdensome for local governments because we're doing this for the first time, and there were various difficulties in carrying out the process. So guidance and reference materials were provided to different local governments So as a result, we proposed 17 indicators in 3 sectors. This portion is going to be presented in greater detail by Dr. Jung later on. So how did we utilize these indicators? First of all, we were able to compare environmental health conditions between nations and regions. I was going through the report and I jotted some information down. The Environmental Science Institution, I believe, will be able to have a chance to share this information in greater detail. In terms of environmental illnesses, there was an analysis done by time and space. There was also a comparison in 2022 comparing Korea and the EU. For example, respiratory diseases. Korea is, for example, how much higher in terms of the percentage compared to EU in terms of the incidence of the respiratory diseases. And as for COPD, EU is 2 times more. Asthma, Korea stands at this percentage. So there was a comparison chart between how Korea was doing versus EU in terms of different illnesses, environmental, COPD, stroke, and also skin diseases and different areas of illnesses were covered in the analysis. And as for regional comparison, we had a health plan implemented, and we received that information from 17 different local governments for their implementation progress from the health plan. So the data that was actually utilized by local governments. So this is an actual data. For example, environmental monitoring system, infrastructure building, that shows that the local governments utilize this data to do these projects. And also they did the indicator trend analysis by space and region. They also came up with the evaluation model using the weights. So going forward, how can we advance and make our environmental health indicators better? First of all, there should be a linkage between big data sets related to environmental health. As was mentioned by Dr. Court, he talked about the importance of data, and Dr. Hong also said that there's a big challenge around data use. And also, let's say that there's a risk factor. There's PM 2.5 for air pollutants and asthma. But you cannot just look at one single risk factor. There's a multiple risk factors involved. So I want to collect all relevant risk factors and data. So environment and health and socioeconomic indicators. I want to pull all of this information together to come up with the big data so that we can have a environmental and health surveillance system. So this is what we're doing right now. This is the snapshot from the big data that we're developing. This process has been in place for about 5 years. It's quite a vast amount of work that is needed. We're still in the process of development, so we'll be able to go live with this data set next year. Climate, meteorological information is included, and also the unmanned observatory information from the Metropolitan Meteorological Administration, for example, the number of days where the temperature goes below 12 degree minus and so forth. So that data has been collected. For environmental health, there are also air pollutant and pollution related data that is produced by the MOE. And we also look at water pollution, sewage related information, soil quality information, chemical material use. We look at the distribution and use by different regions. So there are different statistics that exist. Also in terms of ecosystem, we look at the vegetation, which also includes urban park data. But of course, that number may not fully reflect the air pollution because there could be socio-economic factors that may be at play or demographic issues. So we're looking at various statistics from different fields, looking at education populational level, and we're also having statistical data such as recipients of basic livelihoods, multicultural population data, population by age, mobile population, land use data, road data, and so forth. So all this information is being integrated. And of course, we also have to look at the budget allocation from the central government's point of view and how that money was used at local governments. What are some of the hazardous facilities, such as incineration facilities? Are there any environmentally negative facilities that are operating in certain region? And so we pull that information, and we also have health impact data, death data, and health data. We looked at the health insurance claims data to understand the deaths, and also the different illnesses such as a COPD, and also heart attack, strokes, and so forth. So by different disease. So Environmental Health Center, there's another center that is in place, and they're conducting the research based on these data sets. Now, utilizing big data, what do we need to achieve and what do we need to do? Basically, as I mentioned before, we want to develop an environmental health surveillance system and establish and implement environmental health policies based on scientific evidence. Monitoring and evaluation were also mentioned by the WHO official. So we want to use the big data to increase the robustness of our database, and also to inform the policy-making process. And this is also being carried out from 2021 as an R&D project. And by the end of this year, 2024, phase 1 project will be completed, and next year we will be able to see some implementation. And there are researchers who are working on the study and research. They call it Salus, the title. This is coming from the Greek myth. This is the god of health. So it's such a good name that was given by the researchers from the project. We hope to be able to utilize Salus and to roll out the system to local governments, so that could inform their process. So that was a brief presentation about the Korea's environmental health indicators. I want to thank the Seoul Environmental Health Center and also the local governments. They have their own environmental health centers. MOE is also having a hubs environmental health centers in different regions of the country. So thank you, and that concludes my presentation.
Thank you. Excellent. Thank you very much. Okay, good. Thank you very much. This was an excellent presentation of what's happening now in Korea, and I would like to thank Ministry of Environment for your leadership. Thank you for mentioning as well the importance of surveillance system. I think Professor Hong talked about it, Professor Hashizume talked about it. I mean, everybody mentioned the importance of surveillance, and more importantly, how effective is it? And the question of using policy response as an indicator, how effective is this? And I would like to spark the discussion. We have approximately 15 minutes for question, but I am seeing you a little bit sleepy, so let's get up. Come on. So we can also motivate a little bit the speakers online. You can also get up. So do a little bit of stretch, up. I sometimes do this exercise. We can spell S and U with the body. So S, and then N, and then the easy one is the U. Great, thank you. Give yourselves a clap. Great. Before I spark the discussion, Dr. Rabi was talking about air quality, and so did Professor here from the Ministry of Health. Does anybody know if Korea is currently satisfying WHO guidelines for air quality? Yes? Raise of hands. Yes, 1. 2. Does anybody know if there's countries in the Western Pacific region that are satisfying WHO guidelines right now? Yes? 2 yeses, nos. Well, just to spark the discussion, I think it's important. Currently in the region, we will have some topic presentations later this afternoon. No country in the Western Pacific region currently satisfies WHO guidelines for air quality, including Korea. So this is not great news, but I will let my colleague talk more about this later. We have mics in the room. Does anybody have a question for our panelists? Thank you. We have one on the 4th row. Maybe we can give a little clap for the translators. You have been doing an excellent job so far. Thank you.
Thank you for the presenters. I have a question to the Dr. Kim and about the individual level of the indicators. We talk about the global level and the international level and local level, regional level, but because of the environmental health perspective, we just talking about the risk factors perspectives, but why not a receptor-oriented perspectives? So I just wonder that because of some children have more health impact to comparing with to other children. So it's just not the same. The individual level are very diversely, widely, affected from the risk factors. So I just have the questions. And other question to doctors at the Singapore case, I'm interested in the individual behavior from that they are aware of some health problems according to the exposure to the hazardous things and the heat but the open burning the behaviors in Korea also we have the same problems but the problem is that because of they are very seniors, they are older, elderly people. Even though we provide any information, it's very harmful to you and to your society and your community. But it's very difficult to reduce that change their behaviors. So you have any successful case of adopting to that practice? Okay.
Thank you very much. I will take 3 questions. I'm noting them down. Dr. Rabi, I can see you're ready to answer your question. I'll take 3 questions and then we'll get the response from the panelists. Another question from the audience? Great. While you think. So your first question was for somebody in particular or general? General. Good. Okay, so the first question for our panelists, and I'm very happy to pass it on to Professor Court first, and then maybe a quick word from Ivan Hannigan on this question of individual risk factors. So how do we straddle the understanding of the vulnerability of different population groups? With a quick word on children, if you can. Over to you, Court. Nice, short and sweet, and then over to you, Ivan.
I'm not a health expert, so I don't know that I'm the best to start. But in terms of the standards development, I think the key is that we have comparable data. So whatever the metric of exposure is, I think it's important that we measure that consistently across domains and cities. And so if the collective wisdom is that we need a metric that is, that is normative to different exposure categories, then we just need to make sure that's done consistently across the groups. So it's less useful for one city to have one metric and another city to have 12 different metrics based on different categories of people. But I'll leave the specific health metrics to the experts.
That's very useful. The reason why I asked you, because I think the notion of cities and understanding population groups is very important. And maybe over to you, Dr. Hannigan.
Yes, thank you. I am an epidemiologist, which means I suffer from problems communicating what the science means. It is complicated, and sometimes we try to express this as primary epidemiological studies and secondarily using epidemiological understanding for health impact assessment. And so the real important aspect of your question on individuals, types of individuals and measurements of individuals lead to primary epidemiological analysis that develops a risk function. Often we do this in a variety of subpopulations and summarize them in a meta-analysis, if we can. And this leads to secondary health impact assessment. That's quite difficult, and they rely on evidence, but also data. Often we can't analyse data for specific subgroups of people like children, and so we have to have indicators. I hope that helps.
Yes, thank you very much. That's helpful. Any other inputs from the panelists or even in the room?
Yeah.
Sure, Dr. Rabi, over to you.
Yeah, so I think you asked about the WHO air quality guidelines, and we've been changing them over the years. And the latest iteration is the 2021 guidelines. And I think the reasoning for that is because we are seeing that at an individual and at a community level, when you have lower thresholds, the likelihood of having particular health conditions is minimized. And at an individual level, that's the importance. And I was trying to convey the message that having publicly accessible data in a layman understandable term equips the public to take corrective measures. And when we're talking public, we are talking individuals who are already affected by asthma or COPD or some other condition, who you are potentially informing that there is a deterioration in air quality. You need to protect yourself, you need to spend less time outdoors, you need to wear a mask, etc. But at a community level also, you're informing the public that it's time for you to take some precautions because there's a deterioration. So that's the value of having real-time data which is accessible to the public and which is accompanied by what do you need to do to protect yourself.
Yes, thank you very much, Dr. Rabi. Just a quick follow-up, and if any other panelists, including Dr. Ji-Yoon Kim here, the follow-up about transboundary effects and haze that you mentioned, the challenge of having individual data for these type of effects and indicators, any note on that? You mentioned fires and haze.
Yes, so if I may, it's Professor Kim you're looking at.
Yes. Okay, I'm not sure I can hear you right now, but it's okay. Let's move on to the following question. We had several questions for the panel. One question was around how to ensure the reliability and the validity of this data and the methodology for national level indicators. The reason why I'm asking this is because the next panel will be about the local level indicators. So maybe I'll start here with Professor Hashisume. Can you say something about the reliability and validity of the data in Japan and your experiences on the methodology and sources?
Right, thank you. Yeah, so the reliability and validity of data, yes, that's very important, I think. For example, in the case of heat-related illness, for example, ambulance transport data has been collected by the fire department in Japan, and it's publicly available on their website. every week between May to September, which is the summer season in Japan. Then, yes, so by using that, everybody can see the trend of the or severity of the heat stroke, almost in real time. Then researchers also can analyze that data so that we can monitor and also the evaluation can be possible if something wrong or problem about the data quality issues. Actually, the data are available for every prefecture. Japan has 47 prefectures, but at the prefecture levels, the weekly data are available in the last week during the May to September. So that kind of data collection system and the openness to the public, which secure the transparency, would be also the good, the measure to assess or evaluation of the data quality.
Yeah.
So that's it.
Thank you. Thank you very much, Professor Hashisume. Maybe here in the room, would you like to comment on the reliability of the data? Dr. Ji-Yoon Kim, here in Korea? No? Yes? Good. Okay. Well, before I close up the panel, maybe I would ask one question that will be relevant to all the panelists. And this question is based on what you have presented of the national level experiences, including for Professor Todd Court. I know that you've been doing something that's really overarching across cities. If you had to say one last word to our audience today about how these national experiences can help localize indicators in local governments, and if you had 1 minute each to do that, can you kindly give us your thoughts? And you can go in the order that you presented. So Dr. Court first, then Dr. Hannigan, then Dr. Hashisume, and finally Dr. Rabi and Dr. Ji-Yoon Kim. Thank you.
My 1 minute advice is that we found that a lot of the indicators across health and climate resilience are collected at the national level, but extrapolated to the city level. And so my one bit of advice is that that is probably not adequate going forward. We can't assume, based on a normalization, that a resilient country equals a resilient city, or vice versa. And so the lesson for us is that cities will have to undertake this effort themselves to better understand their own resilience in the face of health and climate risks, and not rely on national data as much as they do now.
Thank you very much. Very clear. Dr. Hannigan?
Thank you. My perspective is that generally in climate and health studies, we come up against a desire to predict, but really what we end up only being able to do is project. We talk about projections of risk. And that's really important. A lot of groups of people, decision makers, want predictions like the finance sector can do for an economic indicator. They can try to predict what the budget will be or what interest rates will be. It doesn't work like that often in climate and health. And I think we need to be comfortable with that. These are indicators.
10 to 15 minutes.
And they indicate things, but they cannot necessarily be assumed to be a strong predictor with very quantitative estimates. They're still useful though. Thank you.
Great. Thank you so much, Dr. Hannigan. Professor Hashisume, I'll just pass it on to Dr. Rabi first and then to you after. Dr. Rabi, over to you. a final note about the recommendation.
Thank you. I think the most important thing in 1 minute is the creating of awareness. The fact that none of the countries meet the WHO standards is a reflection that we are not aware as communities at large on the importance of ensuring environmental standards and its health impact. So the most important thing is continuing to make awareness of the potential health impacts of environment and the benefits of mitigating them from a health, not only from a health perspective, but also from an economic perspective.
Thank you very much.
The indicators will drive it.
Yes, yes, definitely. Thank you so much, Dr. Rabi. Over to you, Professor Hashisume.
Thank you. I think the principles of the environmental health indicators, already well summarized in the Professor Horn's presentation slides. That should be consensus-based, science-based, and we also need to consider the available resources. Also health burden, up to the health burden, and public awareness also cannot be ignored, I think. For the consensus-based consensus, I have been involved in the health working groups of the health impact assessment. That judgment based on the evidence, level of evidence, and agreement among experts. When the evidence is not enough, for example, mental health in Japan, the expert judgment have to be agreed. But still, each expert has a different ideas or opinions. In that case, we need a kind of common understanding how to agree. The kind of guidelines would be needed. Thank you.
Thank you so much. Last but not least, our lady of the panel, a few words from you.
Yes, I'll just make some brief comments. We talked about data reliability and validity. I think my comment would be connected to that in a way. In terms of reliability and validity of data, I think this is really a responsibility of the central government. We have Korea statistics information that are provided by the statistics office, and then it goes through the verification process, and then it becomes a national data. And then there's, of course, local data that is not really fed into the big data, but there are really field-driven, realistic data that comes from the local grounds, and that has to be shared because data standardization would be a very challenging issue. But national data and local data would have to be reconciled, and based on which we can develop environmental health indicators and advance them further. And we would need to have some discussion around that. And there are local environmental health centers at different regions, and then MOE and also the Environmental Science Institute has begun such practical working level discussions. For example, what data that we need at local centers and what kind of support that we can provide. And I believe that we should continue to promote cooperation amongst each other. Thank you.
Great. Well, thank you. Well, thank you very much. So thank you very much to all our panelists. I think we can all agree that these presentations were very, very fruitful, very interesting. And I hope you have a nice lunch. See you later. Thank you.
Experiences. Thank you all. Thank you again. Ladies and gentlemen, we have reached out to the lunch break, and we hope you are ready to refuel and continue the engaging opportunities. Enjoy the delicious meal with the networking with the fellow attendees, and don't forget to be back by 1:30 p.m. For the speakers, please follow our staff over there, Mr. 방역 처장님, there are just 5 minutes walking distance from here. All the speakers, please follow. 그리고 나머지는 한국어로 안내를 드리겠습니다. 참가자
And for the rest, the lunch venue is a little bit different. So then for the speakers and the VIPs, then yes, they will be following Mr. Bang Hyuk. And then for the others, it is on the room 208 in this same building. So you may receive the lunchbox on your way out and then move to room 208, which is one floor below.
Good afternoon, everyone. Welcome back to the afternoon session. We have a series of enlightening presentations and panel discussions lined up for the rest of the day. Our next session is about introducing the Korean local government indicators. It's my pleasure to introduce the chair of this session, Professor Woo-Jin Kim. Dr. Woo-Jin Kim is the director of the Gangwon Environmental Health Center. Please welcome Dr. Woo-Jin with a round of applause.
So session 2 is about introducing Korean local government indicators for environmental health. So we're going to invite to the stage our first speaker, Dr. Jung Da-eun. Got a doctor's degree from Duke University in the United States and currently working as a senior research fellow at the Korea Environment Institute. So in terms of policy making for environmental health, she has been involved. And her presentation is titled The Strategy for Establishing Environmental Health Associated Indicators in Local Governments.
Thank you very much. As just introduced, I am Jung Da-eun from the Korea Environment Institute. Now, first of all, let me say what a great honor it is for me to be able to deliver the results of my research. So I would like to thank the WHO as well as the Seoul Environmental Health Center. Now, today, what I would like to explain is the strategy for establishing environmental health associated indicators in local governments. Now, the content of my presentation, the background, then the local environment and health indicators strategy, then also the introduction of what we have developed, and then last but not least, along with the theme of the symposium related to climate change, in other words, the considerations for municipal environmental health policy in relation to climate crisis. Now, first is the context or the background of this study. Now, in 2021, the Revised Environmental Health Act added a provision mandating 17 metropolitan local governments to establish environmental health plans. Not only that, starting from 2021, the second comprehensive environmental health plan went into effect, and this plan adjusted the direction of policy from centralized environmental health policies to strengthening locally oriented environmental health systems. So as a result of this, the 17 local governments have to come up with the environmental health plan for every 10 years and to implement it. So then, aside from the South Chungcheong province, then for the first time, they came up with regional or local environmental health plan. So then most of the regional governments now have to come up with the plan for the first time. So the Ministry of Environment conducted a pilot study on the establishment of local government health plans and developed guidelines for the drafting of such local environmental health plan. And also in the guideline, then it also provides details about the environmental health indicators. For example, the exposure control and surveillance, and also the exposure to environmental hazards. So investigating and monitoring environmental hazards and developing countermeasures in areas of health concern. In addition, to come up with new decrees and regulations in the local government, and also to strengthen the scientific basis and strengthening communication with the public, as well as education and governance. And then now, in the course of local environmental health plan, the monitoring and feedback of implementation is a critical component. First, what we need to do is establish performance metrics for each of the plan's key milestones. In particular, for the decree and the plan, then the MOE requires the local governments to submit their plan as well as the progress report. So the MOE also stipulates that each local government has to come up with their plan and roadmap for the implementation plan, and this also requires that they need to come up with their indicators for monitoring the progress. And there's also the feedback loop where the result of the monitoring or the evaluation would also be then fed back into the next planning stage. So then there were a lot of questions about what kind of indicators should be included. But then now, as was mentioned by Dr. Kim earlier, now there was the national level indicators that were created in 2021, but then because of various reasons, it was difficult for the municipalities to implement them because, for example, the national plan as well as indicators, now they require refined and sophisticated analysis, and it is hard for the local governments to measure based on the indicators and report on them every year. So then, together with the Ministry of Environment, and what kind of indicators were to be used. So, and also what is the strategy for coming up with the indicators were necessary. So in relation to this, then we also came up with the strategy for coming up with the local environmental health indicators. And we also utilized the framework of Deep Sea, which is also being used by many different countries. So we presented a strategy that utilizes indicators for each stage of the environment health chain using the Deep Sea framework. Since those of you here have already heard about Deep Sea, so I'll just very briefly touch upon this. I just want to emphasize that the Deep Sea framework provides a holistic picture of the entire process of the environment health nexus and allows for policy interventions at each process or level, providing feedback from each process. And also for the members of the local government, then it is highly useful in coming up with the overall picture and framework. And that is why we also thought that we could develop indicators based on the Deep Sea framework. Next, now let me explain a bit about our strategy. Now for the local environmental health plan, now in addition to the Deep Sea framework, we also considered the EPA system of environmental indicators. So this is the logic model. So we also came up with the indicator system based on this. So as you can see in this box, the EPA's indicators, it includes the administrative indicators and the environmental indicators. And then there are also, so for administrative, there are levels 1 and 2. And it includes actions as well as institutional measures, as well as the actions by businesses to control emissions. And then for the environmental levels, 3 to 6, then in level 3, this is about changes in the discharge or the emissions. And then level 4 is changes in ambient conditions. Level 5 is changes in the uptake or assimilation. In other words, what goes inside or what moves up in the food pyramid. And last is changes in human health or ecological condition. In other words, the kind of human health or ecological condition that we aspire for. And the EPA indicators can also be linked to the Deep Sea indicators, and especially now because they have divided them into administrative and environmental, we thought that this was going to be a very important tool, or this could also show some important implications for the local governance. And so we also wanted to utilize this framework together with DeepSea. In other words, for the local municipalities, because this was going to be the first environmental health indicators that they will be coming up with. So then from the first to the third year, maybe we can also think about the indicators. It would be difficult for them to think about the indicators all the way to level 6. So then from the first year to the third year, then maybe they will utilize first the administrative indicators, and then later on, once they lay down the environmental health infrastructure or the basis, then they can perhaps also make more use of the environmental indicators. And that is how we design the local environmental health indicators. So then, if I may sum it up again, then now the indicators are divided into administrative indicators, which focus on the construction of major foundation to check short-term results, and environmental indicators, which show the actual improvement in the field of environmental health, as you can see here. Then for the administrative indicators, now these are the indicators that can be used to monitor the performance of administrative activities, such as laying the ground and policy implementation, and can be used for annual performance evaluation. And this can also be utilized in the beginning of this plan. And then for the environmental indicators, now they are further divided into environmental media indicators and environmental health indicators. So this would be the levels 3 and 4, and then the environmental health indicators would be levels 5 and 6. Now for both the media indicators and the health indicators, they're both used to identify changes in environmental conditions or health conditions as a result of the implementation of the local environmental health plan, and can be utilized for interim evaluation and final evaluation of the local environmental health plan. So then this can also be the basis for coming up with the environmental health plan for the later stages. So then we have, so if I may then sum up the strategy against the DeepSea framework. And again, in terms of the, so as I mentioned, first is about laying the ground, and then also managing the source of emission. So in other words, what can be identified as actions, they can be set as short-term indicators. And then also then for the changes, like for example, manpower or budget, and also inequity. So in other words, what is about laying the basis for the social infrastructure, then that is again for the short-term indicators, and then for the overall environment or health. So what we can check utilizing monitoring, then they can be for, so these are the items where we can also check utilizing additional indicators, meaning that they can be for 5 to 10 years. And then the results of the evaluation of the short-term and the long-term indicators can be reflected back into the implementation of the plan for the next stage. And now, for the local authorities, what they can utilize as local indicators, what is important is that commonly for the different local authorities, then we also need to have the evaluation method for each, for commonly to evaluate their plans. But then we also need to have region-specific indicators to evaluate their implementation. So then in order to come up with such indicators, then this is to assist in the thinking process for selecting community-specific indicators. So for example, then what are the common hazards in our local government, or what are the main environmental health issues in our local government, or what health conditions or diseases are associated with these hazards, and then also how is the condition of our local government compared to other regions. are there any causes of concern? And also, what are the hazardous factors that need to be improved first in our local government? And also, when based on the deep sea framework, then what is the health and environmental chain that causes the selected priority issues, and where are the points where we can have our intervention? And what is the action plan for such policy intervention? And then also, what is the ultimate goal to be achieved through such intervention? So then these are the list of questions that you can go through to select the community-specific indicators. And then afterwards, then you would then naturally lead to the indicators that could be used as community-specific indicators. And then also last is what data or information is needed to measure the indicator, and is such information or data available in the local government? So this is also another important question in this thinking process. So through this thinking process, then each local government could come up with the set of indicators that are based on the deep sea, that are right for the community. So as I mentioned earlier, we have proposed the administrative indicators and in other areas as well. And then for the administrative indicators, there are total 8. And for them now, in 2022, among the 17 municipalities, now they were drafting the environmental and health plan, and they were also coming up with the indicators for this plan. So then we also analyzed these indicators to see what can be commonly used. In other words, what were some of the indicators that were being considered by all of the local governments, and then also for the local governments, what are the issues that are specific to them, and what can be the indicators that are specific to these region-specific issues. So as a result, we narrowed them down to 8, as you can see here, and then there's also the deep sea classification for each. And then for the administrative-related indicators, now this is just an example, but now, for example, increasing the local organization and also laying the organizational foundation. So again, mostly administrative side. And let's say, for example, starting or initiating administrative projects and also identifying new environmental health projects. So for example, developing human resources and also strengthening communication with the community. So we have also included them as part of the indicators. So then this is the example. So for each project, then the period of the project and the description, purpose, justification, and also if there are some common indicators that we could see among the different local governments, then what they are, and also how we can measure them, and then some examples of the targets, what are the other considerations aside from them, and also whether they are indeed common indicators that can be used by all of the regions, or whether these are indicators that are specific more to certain local governments. So for example, environmental monitoring or new project identification. And last, about training and education programs. So these were also included as part of that. And then also for the environmental media indicators and environmental health indicators, and there are 4. So 4 for media indicators and 5 for health indicators. And here again, as you can see, now they also have to, well, these are not the kind of indicators where you can report on every year. And in fact, it can be after 5 years of starting the environmental and health plan that you can report on these indicators. So then as you can see, the size of the expanded greenery and also reduction in the emissions and so forth are the indicators that have been proposed. So then the indicators that we have proposed then We also organized municipal consultations in 2022 and 23 to share our findings with local governmental health planners and gather their input on our proposed strategy for setting indicators and the use of indicators. And this was done together with the Ministry of Environment. So then the officials of the municipal governments, so we went through these indicators together with them in mutual discussion. And then next is about something that we had thought to be the most important in this process. In other words, that is about the data. So for the local governments, what kind of data can they use? As I mentioned earlier, the indicators that are set and shared by the central government, then it is not something that can be used right away by the local governments. But then now, for the local governments, then for them to get the data for them and to analyze them, then that was not going to be easy. So we wanted to create the kind of database that could be utilized at the local level right away. So then, for the sake of local environmental health plan, now we also created the database to also provide the framework for this. And largely there were two. So first of all, we looked at the state environmental health plan and what indicators have been used. So for example, response to climate change or environmental preservation plan. So there are so many database and data points as well as indicators in the database, and we checked whether they can also be linked to environmental health. So then as you can see, environmental health, climate and air, resource circulation, natural environment, health, energy. So we also extracted the existing indicators that could also be related to these topics. And then you can see where they have been planned and what the plan is, and when the plan was made in what specific field. In other words, it matched back to the fields, and then also how it is related to deep sea, and also whether the type of indicator, is it for environment or others. And then we not only collected the indicators that are produced at the national level, but then we also wanted to come up with the statistical data that could be utilized by the local government. And of course, the local government statistical yearbook. Now, this is the best source for local government, so we also wanted to catalog the environmental health related statistics and extract indicators that can be used to evaluate policy implementation. So as you can see, environment related statistics and then health related statistics. And second, the national statistical data, and also, so we also went through the statistics that we could get from the national portal. And then again, we extracted and put together the data points that are related to environment. So for example, environment, population, general society, public welfare, public health. So we came up with a list of the data points that are on each topic. And then again, the results were once again classified against the deep sea model. And again, this is another example. So from what source is it from, and is it on certain population or for the society in general, and also the information, so depending on deep sea, what type of information this is. So we have also done this classification against deep sea. And also this is, so we also looked at overseas data too. So then the different types of data have been listed. So we have come up with this environmental health related indicator database so that the local governments will be able to tap into them. So the Korea Environment Institute, we have the public database portal, and this database has also been listed there, and anyone who wants to use them can do so by using this QR code. So far I have talked about the strategy for local environmental health indicator, and now I will be discussing more about something that is directly related to the theme of this symposium, which is about climate change. Now, UNICEF defines climate crisis as a crisis of children's rights. So in COP21, they also had the Children Youth Climate Action Declaration. So then this is where they say that the climate crisis should be seen with children at the center, and the policies should also be created based on this notion. Then they also came up with what's called the CCRI index, or the Children's Climate Risk Index, and to see what kind of risks the existing climate policies or strategies pose on children. The reason why I mention this is because now for the local environment authorities, that could include both climate change programs and children programs. Perhaps the climate policy for children could be one of the quickest policies that they can undertake. And then also this is about the countries that have NDCs. And then UNICEF also analyzed the NDCs of the different countries to see how much they consider for children. So then among the 103 countries that submitted NDCs by 2022, only 34% presented NDCs that considered children. So what this means is that in terms of national strategy and also thinking about the mainstreaming of children, then rather than considering children, we can see that the NDCs are more, let's say, general rather than taking children specifically into account. Now, Korea came up with its third National Climate Change Adaptation Plan, and again, related to children, then protection of health of the vulnerable people, and then also focus support for the vulnerable group. And then also in the third plan, we can see that specifically most of the policies for children, now they have to do with climate-friendly children's playground and education projects and teaching materials. So only 1.1% of the total 8,469 projects were actually about children. But when analyzing by keyword search, then about 9% of the projects included children. So this also means that many of the policies ostensibly considered children, but then in reality they did not. And it seems as if that it is necessary to develop strategies and set indicators for mainstreaming children in climate change adaptation policies, because we see that the effort to do so is not enough yet. And we do also believe that this is something that can be done by the local government. So for example, the Ministry of Environment has been conducting the Children's Environmental Health Birth Cohort Project since 2015. So what this means is that we can utilize the data accumulated from the cohort project in the process of establishing Korea's climate adaptation strategy. So we can also develop indicators to show the kind of environmental risk that the children would be faced with at each stage of the development. And then based on this, we can also come up with the plan to deal with such risks. And then also similar to the UNICEF's NDC analysis, indicators for children's environmental health can also be developed for central and local governments as part of their climate change adaptation policies. So for example, Peru, that they have what's called the Green Space Creating Program. And for this program, they specify that space for infants and toddlers must be considered. And also Georgia's adaptation policy also includes adaptation policies for children aged 0 to 8 and their families. And the Philippines also ensures that evacuation space for climate disasters are mother and infant friendly. So these are all initiatives that can be done at the local government level. And they can also lead to the kind of indicators that can be utilized as administrative indicators. Now then, coming to Korea, the risk management of children's activity space is a policy implemented by the Ministry of Environment and local government in cooperation. Climate change adaptation policies for children's playground need to be expanded beyond building carbon-neutral facilities and creating climate-friendly playgrounds. So yesterday I thought of this idea. So, for example, the children safe space that is certified by the local government, then maybe you can also include space called, for example, climate change excellence space. And then also for childcare facilities and kindergartens, they use a lot of toys. So then, if we can also put together the purchase of green materials and upcycling of toys together into this, then maybe they can also be included as indicators to reduce the harmful waste. And of course, these are some of the ideas that we came up with recently, so I'm sure that they are not being considered at local governments now, but then perhaps later on, as we move on to the second and third stages, then these are also ideas that may also be considered and taken into account. Thank you.
We're having technical issues in the booth. We're not receiving any audio feed from outside. We'll resume interpretation once technical issues are resolved.
네, 환경 연구원에서 그동안
So the KEI gave us a presentation on environmental health related indicators, proposals, as well as the health plan that was established at local governments. So local governments have been responsible for developing their indicators and plans, and there was a lot of involvement from the regional environmental health center as well. The same for the Seoul metropolitan government as well. So we learned about how policies were formulated and also learned about various difficulties and bottlenecks that were experienced. So we're going to go to Seoul now. We will invite Executive Director from the Seoul Environmental Health Center, who will share the case regarding the development of the environmental health associated indicators for Seoul. She received her doctor's degree at ENG University, currently an executive director at the Seoul Environmental Health Center. Good afternoon. I am Bang Myung-suk, executive director of the Seoul Environmental Health Center. The topic of my presentation is the current status and challenges of Seoul's environmental health indicators. The presentation sequence will cover, first, the current climate status of Seoul, second, introduction to Seoul's environmental health indicators, our proposal for indicators, and fourth, next steps. Before we give you an overview on Seoul, I want to first explain to you why we decided to have this symposium and what local governments are currently doing in developing environmental health indicators. However, this topic was very much well addressed by the previous speaker, Dr. Chung, and other speakers before me. There was an amendment in the Environmental Health Act that local governments have now stronger authority and responsibility for developing the relevant plans, environmental health plans. So that is why Seoul Metropolitan Government in 2022, Seoul established environmental health plan. And even in order to implement such plan, indicators will need to be utilized, and the need for which is only growing. There are 5 areas, 28 indicators that have been developed by the MOE. Now, based on these indicators, we actually have to take a step further and reflect unique situations and contexts of regions to develop indicators that reflect local characteristics and consider needs of vulnerable groups and areas. So as for the purpose of developing these indicators, they are, first of all, there's a growing need for reflecting regional characteristics, and second, to measure and evaluate the environmental health status of Seoul citizens and understand the level of regional and environmental health. And third is to reflect and evaluate the results and environmental health policies, and also to conduct surveys, fact-finding surveys on the environmental health status of vulnerable areas and communication with citizens. That would be the ultimate goal, using this as a data for facilitating communication with the public. Let's now take a look at the current status of climate change and also the outlook. The graph shows that the number of heat wave days or days with heat waves in Seoul has been increasing and leading to a rise in the number of heat-related illnesses, number of patients. According to Korea Meteorological Administration, the number of days of heat waves and tropical nights are expected to increase significantly, and as such, countermeasures must be strengthened. This is what the report indicates. And also, precipitation, torrential rain, heavy rainfall is also projected to increase significantly. So we need to have countermeasures in place. In accordance with the Environmental Health Act, Seoul Metropolitan Government established the Seoul Environmental Health Plan in 2022. In this plan, one of the key tasks and performance indicators is the development of environmental health indicators. And calculation and publication of these environmental health indicators also has been defined as a KPI performance measure. Also in relation to climate change, addressing health impact or health damage due to abnormal weather is also considered as one of the tasks. Seoul's environmental health indicators reflecting regional characteristics have already been proposed by the Seoul Institute. The basic model used here is the deep sea model. We added population vulnerability to cover air quality, indoor air quality, climate change, chemical substances, water quality, living environment, and vulnerability. So in short, there are 43 indicators across 7 categories. Now, the Seoul environmental health indicators are Korea's first local government environmental health indicators that are reflecting the unique characteristics of the region. Now, this is also built upon the existing environmental health indicator DIPC, and population vulnerability factor has been added. So this indicator is very meaningful. Now, currently, climate-related indicators include 5 indicators. There's a number of days with heat waves. You can see the screen here, the number of days with cold waves, heat index, the number of heat-related illnesses reports, and the number of food poisoning cases. Here we need to take a step further, and population vulnerability can be applied to look at the health impact from climate change. And I would like to propose this as an additional idea. Now, in the Seoul's environmental health plan, there lies measures to address health impacts due to abnormal weather. First of all, deriving and managing vulnerable areas to heat waves and cold waves based on spatial analysis, to identify a Seoul version of climate change vulnerable areas. And this information is then linked back to the vulnerable areas in heat waves and cold waves, and to come up with relevant measures. Second, in climate change vulnerable areas among patients with environmental illnesses, we can also enhance health impact prediction due to climate change. We can look at people with underlying conditions, heat-related diseases or hypothermia and other climate-related illnesses can be monitored among vulnerable groups and relevant countermeasures can be established. Also, prediction of health effects due to changes in exposure characteristics to environmental hazards such as chemicals during extreme weather events due to climate change. Now, third, strengthening response capabilities to environmental disasters caused by climate change. And developing management plans for designated climate change vulnerable areas and to make a policy decision, consider health impacts to establish measures and response strategies, and climate change vulnerable regions. Future climate scenarios can be fed into health impact prediction project. Now, climate-related projects are mainly carried out and led by the Seoul Climate and Environment Headquarters. In May 2024, very recently, in the Seoul Basic Plan for Carbon Neutral, a Green Growth Plan, there are increases in vector-borne diseases, heat-related illnesses due to heat waves, and respiratory allergic diseases due to air pollution have been defined as main risks. There are three directions here to consider. First, strengthening infectious diseases surveillance and prevention response related to climate change. Second, climate disaster-induced health damages, including physical and mental harm, are being addressed through measures. Third, enhancing protection for climate vulnerable groups such as those sensitive to heat waves and cold waves. I believe that the directions have been set very clearly and correctly, and in order for us to move into that direction, there are detailed projects. First, including establishing a responsive disaster medical system. Expanding healthcare visits to climate vulnerable groups and strengthening mental psychological counseling and protecting vulnerable groups during heat waves and cold waves, providing shelters for the elderly and protecting people in small room villages called jokbang or the homeless, and supporting low-income groups and vulnerable groups. And third is protecting energy vulnerable people by providing them with energy vouchers. These plans are in place. Based on this plan and based on each division level projects, Seoul's environmental health indicators and climate-related projects now involve the following direction for indicator development and also consideration of the following factors. First, we have to reflect regional characteristics. Second, the indicators have to be useful for policies and implementable at the local level. And third, addressing the urgent global environmental health agenda of climate change. Fourth, to consider health effects and impact. Fifth, adopting an environmental justice perspective, considering vulnerable groups and regions. These should be the main principles driving the development for the environmental health indicators. And we're doing our work based on this guidance. So, if we may propose environmental health indicators, there's of course those national level indicators that have been established by the MOE. Now, those areas some of them could be applied to local regions. For example, mortality rates due to natural disasters, incidence rate of infectious diseases or vector-borne diseases in Korea, and those rates can be calculated based on the national level indicators. And one of the ways in which we can utilize as a countermeasure, we could also look at the health impact from climate change. We could expand the scope from vulnerable people to people with disabilities, one proposal that we're making here. And strengthening or maybe developing a manual, administrative manual for vulnerable population groups. As was mentioned by Dr. Chang, we don't have any consideration of children in climate change policy. So I wanted to add this point as well. So I want to look at how many policies we have in Seoul that really consider children in climate policies. and also to expand the scope to include pregnant women. So, are there any adverse effects in terms of preterm births, negative effects on births of children? We want to also identify those indicators. These proposed environmental health indicators will be designed to identify the connection between proposed indicators and Seoul's projects, because indicators have to be relevant for the local communities. And we also have to have consultation with the relevant local government officials whether it is possible for them to implement them. And we also need to have a feedback loop to understand how local governments are viewing these indicators, whether they can evolve, and how local issues are changing, how their level of capacity is growing. So these indicators will be utilized for that purpose. Of course, these indicators are not fully done. We will have to continue to listen to other stakeholders so that we can refine them and make them better. That concludes my presentation. Thank you very much.
네, 다음은 제주.
Thank you very much. Next is Jeju self-governing province. Of course, Jeju has its own unique profile. This presentation will be made by Executive Director Kim Ji-eun from the Jeju Environmental Health Center. Executive Director Kim went to Jeju University, got her doctorate degree, currently working as an Executive Director of the Environmental Health Center in Jeju.
네, 안녕하십니까. 제주특별자치도 환경부.
Good afternoon. I am Kim Ji-eun from the Jeju Environmental Health Center. Today, I would like to talk to you about the environmental health indicators in response to climate change for Jeju's future. So this is about the set of environmental health indicators that we can propose for Jeju. Now, first of all, before presenting my content, I would like to first thank you very much for giving me the honor of sharing my presentation with everyone. Now, every year, new issues related to climate change arise around the world.
그래서 저희는 사람들은
And so that is why, of course, in terms of the direct and indirect impact, people are getting a lot of such impact from climate change and related issues. And that is why I would like to today propose environmental health indicators for a safe and healthy Jeju. Now, first of all, the purpose and necessity of proposing environmental health indicators in response to climate change in Jeju are as follows. First, the national environmental health indicators should be tailored to local government conditions. And we need to develop climate change-related environmental health indicators specific for Jeju. And then, utilizing such indicators, we also need to enable regional comparison at the national level. And we also need to evaluate the level of environmental health and identify vulnerabilities associated with climate change on Jeju Island, so that we can provide a foundation for identifying strategic tasks to improve the health of Jeju residents. Next is about the process of developing the indicators. Jeju Special Self-Governing Process conducted the following to respond to climate change and propose receptor-oriented EH indicators for Jeju. First, we assessed Jeju's environmental health plan, as well as related climate change plans. We then reviewed various local government cases and overseas cases. So this was in 2021 that the Jeju Environmental Health Center set up the environmental health plan together with Jeju City. So we reviewed the various plans as well as the documents that are in place. And then again, we reviewed various local government and overseas cases. And then we proposed for climate change environmental health indicators based on the principles of Jeju Special Self-Governing Province Environmental Health Plan, which are preemptive prevention and proactive response, receptor-oriented environmental justice implementation, participation, and promotion of the right to know. Now, as you know, Jeju is endowed with excellent natural scenery and is beloved by many people around the world. So that also means that we have a lot in place, policies to protect our natural climate, natural environment. So starting with the designation in 2007, as a pilot city for climate change response by the MOE, we have established the Climate Change Response Road Plan, Climate Change Response Master Plan, as well as the scenario for energy transition. So in the Jeju City, there are a number of plans and policies that are in place for the environmental protection and also against climate change. But of course, in order to implement the plans, then we also need to have local ordinances or decrees so that we will be able to give a stronger push toward implementing such responses and plans. And that is why we are also enacting ordinances to respond to rapidly changing climate change and to secure momentum and justification for policy implementation. And this is not all. We have identified various climate change-related policy studies in Jeju that are not here, and as well as examples of other attempts. As for our proposal, then, we would like to first propose indicators on health and practical tasks out of the many climate change-related plans that are underway in Jeju. Under the first Jeju Special Self-Governing Province Basic Plan on Carbon Neutrality and Green Growth, there are climate crisis adaptation policy targets and strategy. Based on this, the third detailed action plan was drafted, which also includes health section. The climate change-related EH indicators that we propose are based on the action tasks in this health section. Now, for the EH indicators on climate change, then these are the indicators for each action item. First, in trying to strengthen climate change-related disease management system, it is necessary to identify the trends of infectious diseases among overseas tourists. As Korea's leading tourist city, it is necessary to closely monitor the trend of infectious diseases among overseas visitors. We are also well aware of the risks of infectious diseases like COVID-19 and MERS and propose EH indicators to prevent and prepare against new infectious diseases so that we will not be seeing another case like that. And this is the patients with severe febrile thrombocytopenia syndrome or tsutsugamushi. In spring and autumn, when people go outdoors, then there is a high concern about tick-borne infection from April to November. In particular, in recent years, the period of tick activity has increased due to climate change, and there is risk of exposure to various vector infections through activities like herb harvesting events and hiking. And the action task on minimizing impact of extreme climate, this is on the number of skin disease, CVD, and electrolyte imbalance caused by heat waves. In addition to other heat wave-related diseases, EH indicators for skin disease were also proposed according to the MFDS classification. So, for example, heat wave skin patients, then we can see that there has been a spike in such number of patients from July to August, and likewise in Jeju, with the increase in such patients during the summertime, we believe that it is also important for us to monitor them as well. And next is on the action task on strengthening the management and protection for vulnerable groups, which are the number of times of exceeding the ozone environmental standard and education programs on climate change and health effects. Next, then, let me talk about the future tasks for EH indicator implementation. It should be a priority to identify relevant policies that can be linked to the environmental health policies of the Jeju region. As I mentioned earlier, there are so many policies and plans under the Jeju region that are being implemented for the sake of environment and health. And it is also necessary to establish a research council on the topic of environmental health in the region, so that we can also come up with the next set of policies and indicators, so that we will be able to come up with better informed policies and indicators. And also, we need to establish this council so that there can be policies that focus on protecting vulnerable groups and addressing environmental health inequalities. And also, now there were the most views that have been expressed on protection of vulnerable groups and areas. So these are also the set of indicators that are dedicated to the residents of vulnerable areas. And we believe that it is important to also continue with the ongoing monitoring to identify characteristics of the region. And of course, we do provide support, but then also in the future, it needs to be beefed up. So for example, in terms of the human resources as well as budget, so that we will be able to implement and monitor the EH indicator on this front as well. Well, I apologize for not moving smoothly from slide to slide earlier, but I do believe that the climate change EH indicators that we proposed through the EH studies will be established as practical EH indicators for the people of Jeju. We, the Jeju Special Self-Governing Province Environmental Health Center, together with the Jeju City, will work towards safe and healthy lives of our people. Thank you very much for listening.
네, 제주.
Thank you very much. So that was on the EH indicators in response to climate change that are specific to Jeju. Thank you.
해주실 연장.
Third case sharing will be done by Executive Director Lee Myung-nam from Gangwon Environmental Health Center. The speaker received doctor's degree from Gangwon National University, currently working as Executive Director of the center. I'm Executive Director Lee Myung-nam from Gangwon Environmental Health Center. I will present the current status of environmental health indicators in Gangwon Self-Governing Province. As for the order of my presentation, I will first explain Gangwon Self-Governing Province's plan related to climate change and talk about the need of environmental health indicators and my proposal for the indicators and difficulties that we could face in developing such indicators. Gangwon Self-Governing Province, as you may be very well aware, in 2023 was reorganized from the existing Gangwon Province to Gangwon Self-Governing Province. In Gangwon, there are plans that have been established related to climate change. There are three things: the Master Plan for Carbon Neutrality and Green Growth, and Crisis Adaptation Measure, and Gangwon Environmental Health Plan. In 2021, Gangwon Self-Governing Province became the first province to declare carbon neutrality by 2040, and we have a basic plan for carbon neutrality by 2024. And this year, in 2024, Gangwon State Carbon Neutrality Green Growth Master Plan was deliberated. In the plan, there is a vision of realizing a net zero society that leads the way with people to become net zero society. Versus base year 2030, reducing greenhouse gas emissions by 97%. And in 2022, In 2012, the first adaptation measures were announced. In 2017, the second climate change adaptation measures were announced. And in 2023, the third iteration of the plan was announced. As for the climate crisis adaptation measures, they're based on the vision of a fast step towards carbon neutrality, climate just city, safe Gangwon. In this era of climate crisis, our goal is geared towards creating a resilient, safe, and sustainable city. And in the health part of the climate crisis adaptation measures, the goal is to minimize the medical gap for the vulnerable people, to minimize the damage to health through the establishment of a health risk monitoring system, and also to establish an emergency medical system to minimize impact on people, and also to provide customized services to the local communities. We're supporting window-type air conditioners and also cooling centers for heat waves in vulnerable communities. These have been selected as projects. And in the second comprehensive environmental health plan, Gangwon province is shifting away from the central government-driven policy to a regional policy for environmental health management. Accordingly, we came to establish our first Gangwon province environmental health plan in 2022, with the vision of clean Gangwon, clean homes, and healthier citizens. Gangwon province aims to establish an environmental health safety network and promote health and ecosystem soundness under this environmental health plan. In relation to climate change, there are two tasks that we're implementing. First is to conduct a health impact assessment for vulnerable groups in climate change, and second, to provide support for environmental health services. However, the research report on proposal on utilization of environmental health-related indicators, if we may refer to them, we're comparing the environmental health indicators of Gangwon province and other regions that have established regional environmental health plans. We identified that there are no environmental health indicators related to climate change in Gangwon State. However, Region A, children's atopic dermatitis, asthma, allergic rhinitis, and respiratory and cardiovascular diseases, in terms of their prevalence, are environmental health indicators, while Region B and C, quite similar, atopic dermatitis, asthma, allergic rhinitis, in terms of their prevalence, have been defined as environmental health indicators. As you have seen before, Gangwon's environmental health plan does not have indicators related to environmental health. In 2021, there was an amendment to the Environmental Health Act. Now, regional communities, the governments, need to establish their own plan and to come up with the relevant indicators. However, it is difficult to just apply national indicators to local levels. Therefore, it is necessary to develop indicators that are closely linked to the implementation tasks of local governments' health plans and that can identify local conditions that is also locally relevant. There is also a need to develop environmental health indicators to ensure continuous management of implementation tasks. As I mentioned before, because we don't have the environment-related indicators in the environmental health plan, I want to now take a moment to propose to you what type of indicators that we could include in the plan. And I will link this back to the 2022 environmental health plan that was established for Gangwon. First of all, health impact assessment for the vulnerable people and providing environmental health services for the vulnerable people. It is due to the fact that there has been increase in temperature leading to the number of heat-related patients. So prevalence of heat-related illnesses due to heat waves will need to be calculated to select the vulnerable groups from climate change and conduct health impact assessments and provide necessary services. Also, in strengthening the prevention and management of environmental diseases, here we want to identify environmental risk factors in the living space to drive improvement in indoor environment for preventing and managing environmental diseases. So this is about measuring indoor air quality for identifying needs for support. Atopic dermatitis, asthma, allergic rhinitis, and other environmental illnesses in terms of their prevalence can be calculated to identify sensitive and vulnerable groups and improve the indoor environment. Last but not least, Strengthening the response to health damage to residents in air-polluted areas. This is a project to address air pollution and high concentration of fine dust in Gangwon-do. This is to calculate the mortality rate of respiratory system and CVD and selecting vulnerable areas according to the mortality rate to deliver health examination services for the needy. There has been a growing interest in environmental health, and for the local residents, we need to understand the current status of environmental health and health impacts for the residents, and we must develop those indicators. But there are a lot of challenges that would need to be addressed, as was mentioned by Dr. Chung and Dr. Park and other speakers. In order to implement environmental health policies, air pollution, indoor quality, and climate change, these factors have to be more detailed analysis, deep dived and analyzed in greater detail. There should also be an integrated database that contains this information, but at a local level. For example, we had a basic administrative unit of local government, Myeondong. There aren't many statistical data that can be utilized. It's also very difficult to analyze any data. And also, we're making a lot of effort to understand the differences, but there are demographic changes, population changing, and there are also inequalities across different regions. So it is very difficult to understand the differences in different local communities because communities have varying degrees of development. Also, third, environmental health indicators have been proposed to be continuously monitored, but local governments in enforcing environmental health plans are having difficulties in confirming the direct impact of the plan. That is why there are difficulties that need to be considered in developing relevant indicators. Because also these indicators are quite administrative indicators that we get from the central government, so it's very much focused on performance. And to address this issue, it is necessary to obtain national and local government statistical data, and easily accessible environmental health database for local governments should be established first and foremost. And to establish such database, we will need to listen to the local governments. The central government should listen to the opinions of local governments in establishing a database, and there should be continued communication between the central and local governments. That concludes my presentation. Thank you very much.
네, 시간이 많이 지나서 원래 계획대로라면 한 5분.
We're a bit behind our schedule. So maybe we could just have a very brief panel discussion. Maybe 5 minutes.
네, 발표자들을 모셔서
We're going to invite our speakers back to the stage to have a panel discussion and Q&A.
네, 먼저 참석하신 분들 중에
First of all, we would like to ask the audience if you have any questions, any common questions that you can pose to our speakers. If not, then Dr. Chung.
내용을 듣고서
Well then, from Dr. Chung, then any advice from your side after listening to the local government's presentations? So then in the beginning, I thought that there would be a lot of challenges, but then now it seems as if there are not that many challenges, especially not that they have spoken about. So then, of course, there are some areas where they need further studies. Then in terms of the studies and follow-up analysis, then what do they need to do, or what can they do to do them better? Well then, thank you very much. And I see that from the local governments, they really put in a lot of hard work into this to get such neat results out of such challenging process. Now I understand that from the local governments, then environment, dedicated civil servants are not very clear or not that many. So I understand that because of such a lack of resources, then the environmental and health centers have also had to work a lot. But then I also would discuss with the local government officials and also with the centers. And then I believe that what is the most challenging for them is data, because the national level data would be, well, then in the morning, one of the speakers also mentioned this, but then turning the national level data to and utilizes to extrapolate to the regional level is nearly impossible. Then also likewise for Korea. So from the local governments, then when the concept of health is not very clear, then of course when they get the support from the center, then they would. But if not, then for the data, where can they find what data, how? And even if they do find the data, then they wouldn't know how to apply this. So then in the beginning, I talked about laying the basis, and what I thought was the most necessary was to lay the basis to come up with the region-specific data. So then for the local environmental health centers, one of their important roles is to analyze local data. So then perhaps so I'm not sure whether how this would be possible, but then now in coming up with the first environmental health plan, then first, at least you would have to collect as much data as possible, build up a regional database and open as much as possible, and then based on that, build on the second and the third installment of the environmental health plans. Yes, thank you. So in the morning session, Dr. Kim from the Ministry of Environment also mentioned that there are a lot of meetings and a lot of efforts about data and database. So yes, this is something that requires ongoing interest. And yes, data is something that we have been discussing for quite a long time, but the database has not been built yet. So again, I believe that this is one issue that merits continuous attention and also perhaps continuous request as well.
마이크 좀.
Can we pass the microphone? Hand it over to the person in the audience. Yes.
안녕하세요.
Hello.
사실은 저희 산림환경학과 전공하고
I majored in forestry and environment, and I am not an expert in this field, but I do have a lot of interest in this field, and that is why I decided to attend this meeting in the first place. After I've listened to all of you, now local governments are now trying to develop these environmental health indicators. And we've been talking about the need for the development of the indicators from the early on today, session 1 and 2. Although I'm just a citizen, we understand that there's a need to do this and we have to go into a certain direction. But now, these local governments have come on and have been sharing their stories. So, what type of maybe an illness that you want to focus on at different regions? I was not exactly sure how you're doing something that is different from other, for example, provinces like Tsugamushi, because of the time period, looking at the prevalence rate, data. Is there, for example, unique focus that you place on certain diseases given your own characteristics of a region? If you could give us more details about that. I know that there were time constraints. Maybe it's not a relevant question. So if any local government, do you have any special areas of focus? Heat waves, of course, it's a commonality. It's a common denominator that we see across regions. Is there any special area that you are really focusing on that may be different from other local governments? Do you have any basic ideas in your mind in terms of the direction for developing the indicators?
Then Jeju, you mentioned that how you need to monitor the epidemiological trends in overseas countries. So maybe you can elaborate a bit more. Yes, hello, this is Kim Ji-eun from the Jeju Environmental Health Center. Now then, to your question, what I would like to say is that now starting in 2022, now at the Jeju province, then in coming up with the EH plan, then in terms of the indicators, then, well, the indicators, it was the first time for us to work on them. So then in terms of so we could develop only the kind of indicators for evaluating performance. Because of that, of course, we do a lot of projects and programs, but then now for these programs and projects, then how much of a direct impact they have on the Jeju residents. So for example, in terms of many of the environmental issues or the diseases, that would have a direct impact on the Jeju residents. So for them, then we need to develop indicators more directly related to them in the next round of EH plan making. So that is our current plan. And then now, so we are thinking about the kind of indicators that we can come up with for such diseases. Now, first is ticks. So from around April to November, then we see that, I'm sure that you have also heard about them from the news reports, but now in the case of Jeju, then the tick-mediated infections. So we see that the period that these ticks are active is also getting longer. So then for the tick-mediated diseases, we need to focus on them a bit more than other regions. So we thought that that is one thing that we have to focus on. So then in terms of the environmental health indicator, I would say that this is one indicator that would be specific to Jeju. That is why I mentioned it earlier. Thank you.
네, 지금. Lee Myung-nam from Gangwon Environment and Health Center. As for Gangwon self-governing province, in general, we have Taebaek Mountain Range. The east and the west side are quite different from each other. If you go to the east side of Taebaek Mountain, there are a lot of heat waves related issues. Gangneung, Donghae, Samcheon. There are incidents of heat waves, so a lot of issues in terms of heat stress and heat-related illnesses. So it varies by different regions, and I think indicators really have to reflect that as well. And when you go to Donghae and Samcheon, the other side, Chuncheon and Wonju, fine dust is a big issue. The concentration level is very high. Respiratory or the CVD, these illnesses and their prevalence can be considered in developing the environmental health indicators. That's why that information was included in the PPT as part of the proposals for the local government. Although this was mentioned previously, the environmental health indicators are still in the development phase. We really need to conduct more thorough analyses to find the relevant indicators for local communities. That is why we said this is phase 1. And this will have to be advanced further and also merit more attention from the public. Any comments or questions here? I'm Kim Yunan. I'm currently majoring in administration, public administration. Thank you very much. I have a lot of interest in this area. Environment could also deal with ocean environment, maritime environment. If it is, for example, Taeyang and Mando, there are various maritime restoration projects. I want to understand whether there are indicators that are related to restoration of the environment, not just diseases. And it would also have to be disability-free and discrimination-free indicators. And MOJEF has a youth group mechanism. One of the tasks is related to climate change. There were 12 proposals that were made to the government. And I believe that 6 proposals have been accepted out of 12, which is related to the youth. What's the current process? If you understand, whether there's any work on the way for developing environmental indicators for youth. Thank you. As for healing, therapy programs, I think for Jeonbuk, there are fertilizer plants, and then they want to restore the communities, and there's a healing program that's part of the environmental health program at a metropolitan government program at a level. And of course, this new project was also proposed as an indicator. And not only that, I understand that environmental health services are also taking into consideration the points that you mentioned, and some of them are linked back to the indicator development. So can the maritime restoration, marine restoration, the projects that are led by MOE, there is a health day camp for those children who are suffering from environment related illnesses or the vulnerable people. And the Park Corporation, they work as a partner to provide a day of education, publicity, and also service delivery. That project has been going on for a while. Of course, they're not defined as a performance indicator, but Seoul metropolitan government and other governments are also embracing this idea. And if you link it to the indicator, I think it could really be a useful indicator. Any words related to youth? I am not exactly sure about the youth-related projects. Among the projects that are done by MOE, I think it's one of the blind spots, because in the Environmental Health Act, there's a reference to the vulnerable people and the youth, but especially as they're going through puberty and they're affected by environmental factors. The youth and adolescents, their plans and the programs, they're mostly led by the Ministry of Gender Equality and Family rather than the MOE. But of course, MOE is more than open to probably embrace those ideas. I cannot probably speak on behalf of the MOE, but I'm sure our director could say yes to that. I think we need to wrap up this discussion. So in the morning, we adopted a global approach towards looking at the indicators in the context of climate change. Second session focused on what local governments were doing in indicator development. We also drew some very interesting insights, shared stories, and also identified some future hallmarks. So thank you to all our 4 speakers and also to our active audience. Thank you very much. This concludes session 2. 선생님 5시 전에 끝나겠는데요? 그럼요? 네. 딱 맞춰서 하세요, 지금. 저한테 몇 분까지 해야지. 15분까지는 괜찮지만 그 이후는 좀 어렵다고. 그 안에 끝내는 거예요. 힘들다, 힘들어.
Thank you, Director Degelu. Next session is about lessons learned and recommendations on indicators from the thematic areas. The chair for the session is Dr. Roko Kim. Dr. Kim is a principal research scientist at Seoul National University's School of Public Health. Please welcome Dr. Roko Kim with a round of applause.
Thank you very much. Good afternoon, everyone. So, this is the third and the last session of the meeting, and I am honored and very pleased to facilitate this session. My name is Roko Kim, and actually, I worked for WHO for 20 years and retired last November. So you can imagine how I am happy to see my good old friends in Australia, in Geneva, in Bonn, as well as in Seoul. So I'm really excited to facilitate the meeting today. As you have seen and you have heard and discussed, we had an excellent presentations globally, starting from the principles and methods of environmental health indicators, and then moving to Korean environmental health indicators projects, and just the session before, we learned a lot about how local governments are developing and using the indicators. Interestingly, my first job in WHO was exactly this topic. I was a project manager for European environment and health indicators. So I became a little bit nostalgic 20 years ago when I first moved to Bonn, Germany, to work with my friend, Mr. Matthias Braubach. It was the actually time when European Union was developing European level, European Union member states, common indicators on different environmental health topics. So WHO was commissioned to do that job, and they hired a new staff, and I was lucky to get the job. And for a few years, I was working in that area. And then I remember several Korean experts visited Bonn to learn about general environmental health development in Europe, because they were actually drafting Environmental Health Act, which was mentioned several times today. So they wanted to learn from the European experience, and I was so happy to provide any information, any advice to them. When I first heard that Korean government was trying to develop Environmental Health Act, I was a little bit skeptical in a way, because that environmental health is kind of research area and kind of a initiative rather than legal enforcement, regulation, funding in Europe at the time, even in Europe. And my Korean colleagues, and at the time, Korean government was thinking about identifying environment-related health conditions and then recognize as environmental disease and then compensate. Oh my God, that is so ambitious. So on the one hand, I was so happy and excited. On the other hand, I was worrying. Anyway, I supported the idea, and then 1 year later, the law was passed and then enforced. Now we are here. It's amazing. 20 years ago, when the Korean government, Ministry of Environment first wanted to do, they were follower, learner. Yeah. Now what I learned today is Korean environment health movement, or Korean environment health kind of policies are quite ahead of many, even European countries. Maybe my European colleagues give their view, but anyway, I am so impressed. So today, I mean, at this session, we have 4 colleagues, 3 colleagues connected by Zoom, 1 colleague here. So first speaker is my good old friend, Mr. Matthias Braubach. I worked with him in the same team when I was in Bonn, and at the time we are working on in the area of housing and health, noise and health, and also indicators thing. Now Mr. Braubach is a technical officer of urban health and inequity. So we will learn lessons from European environmental health indicators work, and also hopefully we can get some recommendations for Korean work. Okay, thank you very much. So I'm sorry, introduction was a bit long, but I couldn't stop sharing with you. Okay, Mr. Braubach, please.
Okay. Good morning from Bonn. Good afternoon to Korea. Thank you for inviting us to present our European experience. And Boko, good to see you, and even if it's only on screen. I'm going to present the European experience on environmental health inequalities indicator. So it's going one step further, not only looking into environmental health information and indicators, but also looking at their inequality information that they can provide for decision making. So I'll be quickly going through the first slides to clarify the approach. It is known to everybody that there's so many environmental hazards that affect all or parts of the population. And for example, looking at air pollution or climate change, we know that it's affecting all or almost everybody in the population. While, for example, for noise exposure in the European Union, for the larger cities, we estimate that there's around 20% of the population exposed to harmful levels of noise. So there is, of course, a variation in how much of the population is affected. But then it is very important to note that exposure to an environmental risk, when we have an average, this is not equal across the population. I would like to show an example. We have, for example, a certain exposure prevalence of 24% in the total population. That doesn't mean that all population groups have 24% of prevalence. It could look very different depending on the social status, at the income level, or the residential location where a certain person is living. And looking at social status, it could well be that an average of 24% is hiding that we have more of half of the population in the lowest social status with a low income may be exposed, and from the highest social status quintile, there may only be very few, and it still comes up to an average across a population of 24%. But looking at the differences, it's a very different picture. And that's one of the first lessons learned on our work on inequalities. There is a huge importance of having data for stratification to better understand how the environmental risk is distributed across the population. And there is a very nice saying that I heard at the Equity Conference to make that point. And it says, if your feet are frozen and your head is on fire, your average body temperature may be about right, but you do still have a huge problem. So we see that the average is hiding a lot of additional information that is exactly important to understand the inequality dimension. We know from real life that there's an increasing interest in many governments, in population, in society, on how social determinants shape inequalities in environmental risk exposure. This is how it looks in real life, and this is how it looks in more scientific terms, looking at how the socioeconomic position at the individual level makes an impact on the environmental exposures and also environmental benefits that you may have at home, in your area, at the workplace. But then at the same time, the socioeconomic position may also affect the vulnerability of people individually or at a community level. And the vulnerability would then also modify the effect of environmental risks and also contribute to inequalities in environmental health status. So it's both looking at the differences in exposure, but also the differences in vulnerability that are important to understand how environmental conditions can affect health inequalities. What we have done in the European region, and we started doing this work about 12, 13 years ago, we had started to monitor environmental health inequalities within the member states of the European region. And we have provided 2 large assessment reports in 2012 and 2019. The second report in 2019 being more expansive and updating information and adding new information to the first report from 2012. And then also we have published country profiles where we compare the development within the countries on inequalities and the resource package to support local and national governments in identifying, assessing, and then responding to environmental health inequalities. In the last report that we put out a few years ago, we have a set of environmental health inequality indicators, and they were stratified by 5 different settings at urban environments and transport, housing, basic services, injuries, and work settings. And this is all we can have data and measurement on health inequalities. What we have now turned to in the last years, we were moving away from the large assessment reports we published twice before into a fact sheet series. And we did that because this way we are much more flexible. Each of the environmental health indicators with the topics I just showed before has in the report its own section, but then we're doing a big report with all of the indicators updated at once. And now doing fact sheets individually for each of the indicators, we're more flexible to react on new data that becomes available, and we can update a few indicators every year. And also this way, we also constantly have an updating, we constantly keep the issue on the radar, and constantly have some publication and some ongoing work on the inequality, which makes it a little easier from the communication perspective and more responsive to any new data that is being published. I would just like to quickly show the structure of the fact sheets to give an idea. It always starts with the first page that provides the key messages. Then we have a methodological page that shows where the data is taken from, what stratifications have been done, for example, by income, urban or rural, by age, by sex. So there's different ways depending on the data. And we show in the table for which countries we actually do have inequality data, because it's not always available for all countries. Then we always have one page that shows the overall data before we look into inequalities. We always have one overall figure to show prevalence and distribution for the whole population in general. And then we move on into the equity sections. And for example, here, that's an example from sanitation services inequality fact sheet. We look into differences by place of residence. So here, urban versus rural. We look into time trends of inequalities, here also over the last 20 years for urban and rural settings. We look at so-called equiplots for the social gradient by income. This is showing the distribution of sanitation services by wealth quintile. And you can see that for some countries, there's a big gap between the rich and the poor. And then we also here have an example where we bring together a combination of socioeconomic and spatial inequalities by looking to the service provision for the urban rich and the urban poor, as well as the rural rich and the rural poor households. And that also gives a picture of inequality combining two dimensions. So each of the fact sheets would look into presenting absolute and relative inequalities, depending stratified by different determinants like age, sex, income, education, and so on, depending on what the data enables us to do. We're trying to look at social gradients across the income or social groups. We're presenting time trends of inequalities, and usually we try to make one or two combinations of social and spatial determinants, like the one shown in this slide, to give a complete overview of the situation on inequalities. And then the final page will always be conclusion and some suggested mitigation steps to tackle the inequalities described in the fact sheet. So this is the work we're currently doing. We have, in the last 2 years, published 5 fact sheets on housing inequalities, 3 related to inequalities in basic services. And we're now working on inequalities related to urban environments. 1 fact sheet on noise complaints is out. We're working on air pollution. And when data becomes available, we'll also look into inequalities in green spaces. And the next round would then be focusing on injury-related inequalities. So this is our work at the moment. On the methodological side, we have also 2 important lessons learned over the years. And the one is that it's extremely important to consider the terminology, especially in English, and in many languages then it is different. In English, you have 2 terms. You have equality or inequality, and you have equity or inequity. And it's extremely important to be sure what you're talking about, because inequalities represent any differences or disparities without making a distinction whether they are natural or unavoidable, or they are avoidable and unfair. Compared to that, inequities represent differences and disparities that we would consider avoidable. We would consider them unfair. They may be the results of systems, processes, or policies that are not fair to everybody in the population. But that requires a value judgment, because somebody needs to make a decision whether it is fair or it is unavoidable. So that is extremely important in any language where there's different terms, to be very clear what you're talking about, and especially in English, that's the case. A second issue that we have come across in communicating the inequalities is whether you present the relative or the absolute equity dimensions. And it's extremely important to facilitate both, because we have here in this example a given exposure to an environmental factor for the poor was 15%, for the rich was 5%. We have an absolute inequity gap of 10%, but the poor are 3 times more exposed than the rich. In another situation, we also have a 10% inequity gap, but the relative ratio is much smaller than for the first situation. So the same absolute gap may lead to a very, very different relative inequality. And that is something that is extremely important to communicate, because just giving one of these 2 figures doesn't give you the whole understanding of what the situation is. And it's important to present both. One of the biggest problems, and that may be the same for environmental health indicators in general, is data. For the inequality monitoring, we have found out, starting to work with national databases, that they are very diverse. They may define a certain risk factor in a different way in different countries. They may have different thresholds for noise, or also for income groups. They may have a different coverage of the survey. So at the end, we use international surveys, as they are more consistent across countries, but you're losing a lot of detail, a lot of interesting information, which you can only use when you work on a national report. Another limitation is that environmental health surveys often do not enable stratification by income, sex, age, etc. It is often not available, and you cannot break down the data. So there's limited use on environmental inequalities of the available data and surveys. And what we also noted is that a lot of data comes actually from self-reported information, because in a survey, you can ask people about their age, their income, their education. But if you do measurements, for example, from air pollution monitoring stations, you may be knowing whether it's a high or a low level neighborhood, but you do not know exactly the education or the income profile of the population living in that area. So that's a restriction too. And we have a huge challenge with data limitations in the eastern part of the WHO European region, because in the western part, EU statistics cover a lot of information, but we don't have that in the eastern part. So there is a strong bias in the region. I would like to also focus on a lesson learned that we had on the relevance of equity information during the COVID-19 lockdowns that we experienced in the last few years, and how the fact that we had equity information available was extremely important to support priority setting in that period. And you can see highlighted those indicators that have a direct association with the impacts of COVID-19 and the lockdowns. The first example is crowding, which of course during a pandemic and talking an infectious disease is very important. If you have many people in a room, disease spreading is an issue. And we see that poor single-parent households with children are much more affected by crowding than the general population. You can see here in Western European countries, the blue bar for the single-parent households is always higher. And we see also on the left, the lowest income quintile is much higher in terms of crowding prevalence than the highest income. Now, if we extend the data to the Eastern European countries, you see that crowding becomes a whole other dimension. And we can see that by just looking at the type of household, the income, and being Western or European citizen, you move from a crowding prevalence of 4% to a crowding prevalence of 75%. So having that information gives you a lot of substance for decision making on where to focus on when you're trying to have health prevention done, because you clearly see where the most vulnerable people are living. Another example is keeping the homes warm in winter, because most of the lockdowns appeared in winter. And we can see that for almost all of the countries, the dark blue spot, which are the poorest households, have the by far highest prevalence of problems keeping the home warm in winter. And we can see there is often a huge distance to the other groups for the lowest income. And we can see that in 2 countries in Europe, we even have more than 50% of the lowest income quintile exposed to problems keeping the home warm in winter. So that's quite something. The last example on inadequate sanitation, this is an example that looks again comparing location, urban, rural, with being rich or poor. And we see that in some countries, the social gap, the social gradient is very high, like in Moldova, shown at the bottom. And we can see that in almost all countries, the most affected people are living in are the poor households living in rural areas. But in some countries, it's interesting to know that it's actually the poorest households living in urban settings. So again, it gives information to policymakers on where to target if necessary. The overall lessons from our work on environmental health inequalities is that over decades, we see environmental pollution levels often decline in many countries. But then at the same time, we see that inequalities in risk exposure often remains, or sometimes even does increase. So not everybody is benefiting equally from the progress. We see that the risks can be 5 times and often even higher for disadvantaged groups, and we see different inequality patterns that require tailored action in each country. Lack of data, as I noted before, is a key challenge, and intersectorial action across sectors is needed because the health sector alone cannot tackle the identified inequalities. So that's leading to the last lesson learned that I want to highlight. It is very important to enable national action to also provide a national intra-country inequality assessment is important. It's much less important to note about inter-country differences between Sweden and Kazakhstan. It's important to note how are the differences within Kazakhstan and where do we focus our action. And we also have seen that national equity assessments can be very helpful to plan action and how to move on. Because this example here shows you a situation where you have a very strong inequality in risk exposure. There's a rather low risk in the advantaged group with the highest social status. And here, this would suggest targeted action, targeting to the most exposed or the most vulnerable subpopulations. In the other example, you still have an inequality, you still have a social gradient, but the inequality is less strong. There's still a significant risk also in the advantage group with the highest social status. And if we have such an equity outcome, you need to look at equity issues, but still here there is more the action to look at the general improvement of environmental conditions and make sure that you ensure healthy environments for all in the first place, because all population groups are heavily affected. So it does give you information on whether going targeted or action for all approach, and going deep into the data, you also understand which are the population groups that you would need to focus on. So for supporting countries and local governments to assess and tackle inequalities, we have produced the Environmental Health Inequalities Resource Package that provides different steps, and within each step, more guidance on action and methods on how to identify and tackle the inequalities that then may be identified in your country. And with this, I would like to thank you very much. I hope that was a helpful introduction into the work, and looking forward to the other speakers and their additional contributions. Thank you.
Thank you very much. Thank you very much, Matthias. Excellent and very interesting presentation on European work on the environmental health inequalities. Already he summarized very well the lessons and some recommendations. You may have realized now that the environmental indicators you are considering so far were not really targeting inequalities itself. So maybe this is a very good lesson for us. You may know those European Union countries are among the most equal countries in terms of their income, social status, and kind of privilege, and so on. You know that. Nevertheless, interestingly, from my experience as well, European countries are really, really concerned of inequalities. Why? Isn't it interesting? As compared to other countries, European countries are most equal. Think about Scandinavian and Germany and Denmark, France. They are much kind of equal than other Asian, African countries. Still, achieving equity and equality is national priority or European priority. That's something we can think about. When do we, I mean, Korean government and we will start this work to make the environmental health impact more equal or protect the vulnerable workers, as Matthias summarized. Okay, thank you very much, Matthias, again. Next speaker is Enke Shini, Dr. Enke Shini. Enke Shini has been my colleague in Bonn Center quite a while. Dr. Enke is a technical officer of Air Quality, Energy and Health of Seoul Center, WHO Asia Pacific Center for Environment and Health. Dr. Enke has a broad experience from national government and also European setup, and also now in Asia. So please, thank you.
It's my pleasure to be part of this important symposium. So as you see, the title of my presentation will be Indicators for Air Quality and Health. So today we discussed a lot about the importance of setting a proper system for monitoring of environmental health. The local context, my presentation might be a bit at more higher level. It's I will talk about the air quality monitoring from the WHO perspective. And then in the end of my presentation, I will provide few examples for how the WHO recommended health-based indicators could be taken at the local level. So maybe many of you will be aware that the WHO is custodian agency for three main indicators, SDG indicators related to air pollution and health. So one first indicator is related to health, mortality rate attributed to household and ambient air pollution, put 100,000 population. And WHO also monitor the global progress of SDG indicator related to population using clean fuel and technologies for cooking at household level. And third indicator is related to the air pollution, mostly the WHO's monitoring progress globally, the PM particulate matter 2.5. Of course, through the global monitoring, we can't really have a lot of indicators. And you already see here that at the local level, indicators are really context specific, as previous speakers mentioned. But at the global level, UN statistics group in consultation with member states came up with these target indicators. So very briefly about the SDG monitoring framework at the global level. The data, WHO has a database on air quality and associated health burden. Data is based on the member state estimates. The data, the WHO air quality team produces national estimates based on the nationally representative surveys and also from research and from the administrative data. Once the WHO team responsible for air quality database update the data is sent to the national government for validation, and the main product is the annual report, which is published by WHO and also by UN Statistics Division. So this is the example, the related to indicator related to exposure to air pollution. So as I indicated, explained this PM 2.5 level. As you see here in the WHO database, we not only monitor the status of current level of pollution or exposure to pollutant, but also we analyze the trend. But you see here, for example, over the last 10 years, air pollution, in this case, PM 2.5 has been decreasing, but very little decrease. If you see here, compared to WHO recommended limit value, in cities, it's far to reach WHO recommended level. From maybe at the average level, if you see here, Western Pacific region, our region, it's about 7 times or 7-8 times less than compared to the limit. But just in previous presentation, Matthias very clearly mentioned that these are the average values. For example, global average, regional average. For example, in Western Pacific region, for indicator PM 2.5, the annual average is 35 microgram per cubic meter. It seems that 7 times less than the WHO threshold. But if we see the details, some countries even it can be country average can be 50. Some higher developed countries it's 7. This is the national average. But we do not have data at the local level. So at the local level, the difference can be very high. So I would like to highlight that it's good to have the database on air quality, for example, from many countries, but the data we have is not sufficient to track the progress in the local level. So that's why today's symposium is very important, how at the local level environmental health monitoring can be strengthened. So second indicator I mentioned about access to clean cooking. If we see here overall, the progress is quite good. And in the region, from 10 to 90%, depending on the country, economic development and use of fuels, the indicator can vary. This data is also based on the member state nationally representative survey. And for WHO, we have a series of guidelines on air quality. One is related to indoor air quality. One of the key recommendations of WHO indoor air quality is really to stop using coal for cooking at home. So that's why through this indicator, WHO is trying to see overall progress at the global level on the using clean foods for cooking in household level. So here I would like to draw your attention on the data availability. Repeatedly we mentioned that at local level we have lack of data. At national level we have lack of data, which actually translates to at the global level. If you don't have data from the national level and local level, it's very difficult to capture at the global level. So you see here the data availability for key pollutants, which we have in WHO database. For the Western Pacific region, compared to other pollutants, we have some more data for PM 2.5, but of course, compared with the European region, our data availability is quite less. And we don't have sufficient data for PM 10, for example, NO2. So which means that the data which we are presenting do not represent the real situation in the region. So data we are presenting it represents only data available for these countries. So if you see here in WHO air quality database, only less than half of countries' data we have, which indicates that through these graphs, for example, the levels of air pollution we are explaining, it's not truly not representing the true picture of the region. So it really shows that it's very important to improve the capacity of environmental health monitoring at the local level, which translates to the, which contributes to have more robust data at national level, then feeding to the global monitoring. So now I'm just would like to draw your attention to this slide. Very often when we have discussed about health surveillance of environmental risk factors, a lot of focus is made on, of course, morbidity and mortality burden monitoring. But there are, if we see the overall pyramid of health effects of different environmental factors, it's very important that large group are exposed and they have subclinical effects of different environmental factors, including air quality. Some may have some symptoms, maybe due to acute exposure, which are not necessarily tracked through the monitoring system. And also emergency room visits, outpatient visits, hospital admissions are not necessarily a part of the current health surveillance system. When the countries local level plan the monitoring indicators, it might be also good to consider the hospital admissions or emergency room visits due to acute exposure to environmental risks, in addition to the chronic effects monitoring like premature morbidity and mortality. So this one is the indicator related to SDG target 3, health burden. So here WHO estimates the country data, the health effects due to ambient air pollution, household air pollution, and also combined effects of household air pollution and ambient air pollution. So, and provide the progress of that in digested and years of lost life. So, in this figure, I just shown the general the structure of mortality burden attributed to joint effects of household and ambient air pollution. If you see here, for example, in the Western Pacific region, ischemic heart disease followed by stroke and chronic obstructive pulmonary diseases that are the most prevalent diseases causing the mortality in the population. Currently, latest available data indicate that about 7 million people are dying due to poor air quality every year. And out of this, 1/3 is happening in the Western Pacific region, which really showed that air pollution and protecting health for the population in the region is the key priority. Today, our colleagues from the local governments presented very informative data on the health effects of different exposure environmental factors, and also highlighted the importance of focusing more attention on vulnerable people. So this data is from the WHO global database, stratified by different age groups. It really shows that children under 5 years old, and also elderly people, people more than 70 years, 75 years, they are more prone, and they're more heavily exposed to the effects of air pollution. For children, we know that because of their physiological characteristics, behavioral aspects, etc., they are more prone to effects of exposure to environmental factors. For elderly population, they have coexisting health condition with the environmental factors. They disaggregate, they worsen the adverse effects in these population groups. So now I would like to highlight, I'm coming to my main part of the presentation. So WHO is the main public health agency at the international level, setting the guidelines in normative documents on health. So for air quality, we have this listed guidelines. Today we discussed a lot about the importance of monitoring ambient air quality. It's very important also to monitor also indoor air quality, because our outdoor air pollution can infiltrate indoor, and indoor air pollution also contribute to outdoor air pollution. So it's very important at the national and local level when design the environmental health monitoring program, also good to include to prioritize aspect of indoor environment monitoring. For the guideline 2021 update, this guideline is applicable both for indoor and outdoor pollution. It provides health-based values, interim targets, and limit values for these listed 6 pollutants, and also provide good practice statements for black carbon, for ultrafine dust, and for sand and dust storm. I think these are why I'm highlighting these main pollutants from the guideline. It can provide good basis for setting standards and monitoring at the local level based on the local risks. And there are also guidelines related to indoor air quality for selected pollutants listed here: benzene, carbon monoxide, formaldehyde, and for example, radon, etc. And there is a specific guideline related to household fuel combustion, which provide the recommendations for emission rate targets for key pollutants like PM2.5 and carbon monoxide. And also it provides a recommendation for policies to transition low emission technologies. And there is another guideline, WHO guideline on household fuel combustion. This is for dampness, for mold, and to control how to control the dampness in the indoor environment. So these will provide basis for the national authorities in local level when design and selecting the key pollutants for monitoring. These are some examples which could be example of indicators at the local level and national level. So depending on the resources, feasibility, technical capacity, and the local source of emission, the standard, the environmental health plan or monitoring plan could be developed. So it's really, this is today Professor Hong mentioned, it's very important for the local level monitoring. It's very important to have national or local level consultation and consensus which indicator should be monitored at the local level. And I would like to, today it was interesting to see that for Seoul City, for example, you choose, I think you have the consensus now to monitor ultrafine dust, right? And then other indicators. So it's really up to the country or local level to decide which is the key pollutant to monitor. So in addition to the classic health damaging pollutants recommended by WHO, in local context, these priority indicators can be chosen. For example, black carbon of ultrafine dust, volatile organic compounds, arsenic of lead, for example. Last week I visited Bangkok, Osaka city for meeting. They monitor, for example, they introduced in the local monitoring ultrafine dust, volatile organic compounds as based in, for example, lead for the Osaka city monitoring. So this really shows that depending on the capacity and the local risks, it's up to the local governments to define the priority indicators. For the parameters for indoor monitoring, there can be different indicators. For example, access to clean cooking and technologies, especially in the places where people use fuels for cooking, not necessarily relying on a centralized electricity supply, for example. For health, there are different indicators, and today, throughout the day, you presented different indicators of health effects. And as mentioned, in addition to total disease burden, cause-specific mortality, total cause mortality or cause-specific mortality, there could be hospital admissions by cause, emergency room visits, for example, stroke or myocardial infarct and asthma, depending on which indicator you are looking for. For acute air pollution effects or combined with heat, these hospital visits, myocardial infarct or asthma could be good indicator for local level monitoring. And in addition, it's very important when you already in the process of setting the environmental health indicators at local level, it's very timely opportunity to embed aspects of equity, monitor equities of exposure to air pollution, for example, and outcome level by vulnerable groups. So I will not stop in this slide, but there is a short guidance by WHO how to improve capacity of countries to report on air quality in cities. It might be applicable for more decision makers work at the national level, but it's very important to see from tools which provide through this document, maybe what are the important questions or important components should be for environmental health monitoring, for air quality monitoring at the global level. So then it could provide some contribution when you discuss the design of the environmental health monitoring system at the local level. So last slide from my side, it's very important based on the standards, regulations to set and incrementally enforce health-based air quality standards. And we know that Korea is one of the pioneer countries in the region which is making progress to align the national air quality standards close to WHO guidelines in Australia and Singapore too. It's when designing the environmental monitoring indicators or system at the local level, it's very important to consider several aspects. What are the objectives of the local monitoring program functions? What are the monitoring parameters, priority monitoring parameters, and the sampling plan, sampling sites, frequencies, and what are the measurement methods? And a very important also aspect, in order to ensure the quality assurance of the monitoring program, what will be the operation maintenance activities for the monitoring stations and quality assurance of data, and what are the data management, reporting and utilization, and feasibility. It's not easy. It's easy to come maybe with list of indicators, but should do very careful check of manpower, human resources, infrastructure for monitoring, financial aspects. All these aspects need to be considered when set up the local environmental health indicators and system. And today, a lot of you already mentioned that it's very important to integrate environmental monitoring with health surveillance or monitoring activities. At the local level, I think it's very important to have a consensus or discussion between different stakeholders, especially public health authorities and environmental health units, how to share this data and how to use this data for environmental protection and public health response. I think that's all for me. Thank you very much.
Related burden of disease is the largest, the most important proportion of the environmental burden. Also, thank you for excellent guidance or suggestions to improve the indicators. So I see the time, and it looks like we have to really keep the time. So we have two more speakers. Next speaker is Dr. Rick Johnston, technical officer at the unit of wash and health, water, sanitation, and hygiene. And Dr. Rick Johnston is responsible officer for the joint monitoring program of WHO and UNICEF, also related to SDG as well. So yeah, Rick, please, lessons and recommendations on wash-related indicators. Thank you. And you have 10 minutes. Sorry, thank you.
Perfect. Thank you so much, Rocco, and thanks for the opportunity to join this webinar, this symposium. WHO and UNICEF do operate a joint monitoring program that tracks water, sanitation, and hygiene in households, but also in schools and healthcare facilities. And we update each of those databases every 2 years. Just a few months ago, or just last month, we published a 2024 report on WASH in schools. And next month, we're going to publish a report on WASH in healthcare facilities. That will make it 4 reports in each of these areas that we've published since the beginning of the SDG period. Let's see. That's great. So I wanted to focus today on the global indicators that are used for tracking WASH. And there are really 2 classes of indicators. There are the SDGs, and there are 10 of them that are related to WASH, whether it's household drinking water, sanitation, or hygiene, or WASH in schools. There's no SDG related to WASH in healthcare facilities. And then there is an indicator about mortality from WASH, similar to the mortality from air pollution that we heard about earlier. And then there are 2 indicators around the enabling environment, one around having adequate support, that's 6.A, and then participation of communities in water and sanitation management, 6.B. Now, many of those global SDG targets are also integrated into WHO's general program of work. We've just finalized our GPW14 plan. It's a 5-year plan. And you'll see that a lot of those SDG indicators are also taken up as priority indicators for WHO. I won't rename them, but I'll note that while there is no SDG indicator around WASH in healthcare facilities, there are 2 GPW indicators around service availability and readiness in healthcare facilities that includes basic WASH services, and then a separate indicator about coverage of WASH in healthcare facilities. So it's very much a WHO priority as well as a global priority through the SDGs. If we look first at households, we have these 3 service areas: drinking water, sanitation, and hygiene. And in each case, we've defined different indicators to represent different levels of service. So for drinking water and sanitation, you have at the very bottom, no services, people taking water directly from surface water or defecating in the open. This tends to be an issue more in Africa and bits of South Asia, not so much in the Western Pacific region. But as you get to the upper levels, you can distinguish between basic service levels where people are using some kind of improved infrastructure and safely managed levels where that improved infrastructure is also delivering a quality service. So if we're talking about safely managed drinking water, that improved water supply should be available when needed, it should be accessible on premises, and it should be free from contamination. And for safely managed sanitation, it's not just using an improved facility that's not shared, but one that also manages the excreta, whether it's a sewage system that connects with centralized treatment or a non-sewage system that has some kind of local on-scale safe treatment and disposal. The hygiene services and indicators are a bit simpler. There's no safely managed hygiene. It's just the basic service is simply having available a hand washing facility in the home that has soap and water so that hands can be washed. So at the regional level, in the Western Pacific region, there are 24 countries that have data on safely managed drinking water, including the Republic of Korea at 99%. And there are 32 countries, almost all of the countries in the region, that have data on at least basic drinking water. And you can see that there's a range. While the regional average is high, increasing from 93% basic to 97% basic between 2015 and 2022, there are some countries that have quite lower levels of service. You can see in Papua New Guinea, basic drinking water is only about half of the population. So we've heard that message multiple times today, that an average can hide big disparities. The reason that there's not a regional estimate available for basic safely managed drinking water in Western Pacific is that we don't have data on drinking water quality from China. So without China, of course, it's not possible to have regional averages. We do know that 98% of the population in China is using at least basic drinking water services, but it would be nice to know about the drinking water quality. There's a similar story for household sanitation, but in this case, we do have data from China coming in at 67% safely managed sanitation, which allows us to calculate a regional estimate showing that safely managed sanitation has increased from 55% to 68% over the last 7 years. Also, we do have data from the Republic of Korea. Again, very high coverage here at 99% of the population having safely managed sanitation. But a good number of countries, only 20 countries having data on safely managed sanitation, and about a dozen or 13 countries that have data only on basic sanitation services. Again, some of those Pacific Island countries having much lower levels of basic services. These data are, by the way, all available on the JMP's website. You can see the URL at the bottom of the screen. For basic hygiene, we again have data from China at 97% having hand washing facilities in the home with water and soap. So that gives us a regional estimate that's very similar at 95%. Unfortunately, we don't have data from the Republic of Korea. Like many high-income countries, data is often not collected about availability of water and soap in households. It's assumed to be universal, but for SDG reporting, we can't take assumptions or statements like, well, of course, everyone has as a national statistic. So it would be nice if at some future stage, some data could be collected, even just once, to show probably that most people, almost all people in the Republic of Korea do have hand washing facilities with water and soap at home. If we turn to healthcare facilities, we have a similar approach with different indicators defined for basic, limited, and no service levels. We don't have higher levels of service, like safely managed services for healthcare facilities. And I'd say that the basic service level is really quite basic. So for water, we're simply talking about having water available from an improved source on premises. I won't read through the definitions for the other ones, but I will note that in the special case of healthcare settings, there are additional service levels defined and indicators defined for healthcare waste management and for environmental cleaning that apply particularly to the healthcare setting. However, I think in high-income countries, these basic service levels are really probably universally met, and many countries are more interested in defining and monitoring progress towards higher levels of service. For instance, not just having functional hand hygiene facilities available at points of care, but looking at actual compliance by healthcare professionals. How often are they practicing hand hygiene at key moments. If we look at water or sanitation, we might be looking at quality and treatment, not just access to basic infrastructure. Looking at the regional level, for those 5 service levels, water, sanitation, hygiene, waste management, and environmental cleaning, unfortunately, we don't have enough data to make regional estimates for the Western Pacific region for 2023 for any of those. And that's because you can see we have a small number of countries, only 8 countries with data on environmental cleaning, ranging up to 15 countries with data on basic water in healthcare facilities. And I'm afraid that we don't have data from China for any of these. So again, no China, no regional estimates. We actually did have data from China from a 2018 survey that was done in healthcare facilities, but that's too old now to use to say what the status is in 2023. We can use that 2018 data point to look at the status up until 2022. And if you look at our website, we did have regional estimates for basic water and basic hygiene that derived from that China survey, showing that less than half of healthcare facilities in the region and in China had basic hygiene facilities. And that's mainly because soap and water were found not to always be available at healthcare facilities in China. So we hope, again, that there could be additional data collected from China and from the other countries that don't yet have estimates for these basic service indicators. Turning to schools, once again, there are only 3 service areas: drinking water, sanitation, and hygiene. Only 3 service levels of basic, limited, and no services. And again, the basic service level is very basic. It's just about having drinking water from an improved source that's available at the school, having toilets that are single-sex and usable, and having hand-washing facilities with water and soap available at the school. At the regional level, again, we don't have data from China. We have data from most countries, including the Republic of Korea, which is at 100% for drinking water, sanitation, and hygiene. But again, until we have data from China, we can't say much about the regional level, and it also limits our ability to make robust estimates at the global level. The last indicator I wanted to talk about is the mortality from unsafe water, sanitation, and hygiene. This was updated last year with a reference year of 2019, and it includes deaths from diarrheal disease attributable to unsafe water, sanitation, and hygiene, and also to acute respiratory infection attributable to inadequate hand hygiene. We know that washing hands with soap is a critical way to break transmission of respiratory infections as well as diarrheal diseases. We see in the Western Pacific region that the levels of mortality are much lower than in Africa, and also lower than in Southeast Asia, but a bit higher than in America's Eastern Mediterranean and European regions. And then within the Western Pacific region, there are a small number of countries that have higher mortality, expressed as a mortality rate, deaths per 100,000. In Kiribati, the Solomons, the Vanuatu, Papua New Guinea, and Lao PDR, it's all above 20. In the Republic of Korea, it's much lower. It's about 5 deaths per 100,000, and that's completely attributable to hygiene, where even if people do have access to water and soap in the home, we know that people don't always wash their hands at key times, so there remains some risk of having acute respiratory infections that could have been prevented through better hand hygiene. My last slide then is about country consultations. Whenever the JMP updates a global database and prepares a report, we share the draft estimates with the countries for their review and reflection. We prepare a guidance note. It's circulated through our country offices, the WHO and UNICEF country offices, and we rely on them to reach out to the relevant national authorities to ask 3 questions. The first is simply, are we missing any relevant national data sources? Perhaps there's something that exists that we're not aware of. Are the data sources we found, are they reliable? Should they be considered as national statistics? And third, is our interpretation and classification correct? It's always possible that we make some mistake. So the country consultation is really a key opportunity for countries to review and make sure that the global statistics really are the most accurate and up-to-date as possible. Since we're updating one of these global databases every year, households in one year, or then schools and healthcare facilities the other year, we circulate the drafts usually in November. We ask for feedback by the end of January so that we can finalize the estimates in February and March and publish the report in the coming summer. So coming up in a few months, in November 2024, we will be circulating draft estimates for WASH in households. I hope that both in Korea and in the other countries in the region, we can have a thorough review of the draft estimates and hopefully fill any gaps so that the data are up to date. Thanks very much. Looking forward to the discussion.
Thank you very much, Rick. Yeah, JEMP program might be among the most well advanced and systematized indicator system at the UN system. WHO and UNICEF are reporting the global situation of water, sanitation, hygiene, as Rick nicely presented. You can see how helpful to understand global overview. So if you think about your local government, if you can assess the situation of the small Myeon, Lee, Up city, and so on, just like this JMP program is assessing the situation of different countries and different regions. Thank you, Rick. Very helpful. And also thank you for keeping the time, 10 minutes. Last speaker is Dr. Carlos Covalan from Sydney, Australia. Also, yeah, when I joined WHO, already he was a senior officer in Geneva in the area of environmental health, and he was the one who really led WHO's initial work on environment and health indicators. So his seminal paper is very important. Today, many people mentioned about Deep Sea, EPSEA. That's one of his original work that contributed to this area. And he served in WHO in Geneva and also in PAHO, Pan American Health Organization. And then after retiring several years ago, he also worked with me in the area of climate change and health when I was in Fiji. And now he's working with the WHO Climate Change and Health Program in Geneva as a consultant and doing a lot of important work on the vulnerability and adaptation assessment and development of national health adaptation plan and so on. So I'm so happy to see Carlos here, and welcome. Okay, thank you. Please.
Thank you very much, Rocco, for this introduction, and thank you very much for the organizers for the invitation. It's a pleasure also to hear that the old Deep Sea framework has been mentioned. I wasn't able to participate during the previous events because I'm now in Portugal. I'm in Lisbon at the moment, and it was 2 in the morning when the event started. But let me go ahead and start with my presentation. So I'm going to be focusing on indicators to measure climate resilience and greenhouse gas emissions of health systems. And this is very new work. This is not something that we can present what we have done, but we're actually presenting what we're going to be doing. And to give you an overall context for this, very important that Richard mentioned the 14th General Program of Work, the GPW14 of WHO, just approved at the World Health Assembly in May, and it recognizes the importance of climate change. So it says the pace of climate change and environmental degradation has accelerated, emerging as a major threat to human health. And importantly, one of the 6 strategic objectives for the GPW14 is to respond to climate change and the escalating health threat in the 21st century. So we have a very important task to cover two areas which needs to be monitored. So there will be two indicators for these joint outcomes. One is indicator for more climate resilient health systems that are addressing health risks and impacts, and the other one for measuring lower carbon health systems and societies. So this is the context of the presentation and of the work that we're doing. But it's not the first time we're tackling indicators. So of course, WHO has been collecting data on climate and health and other variables. And for example, every few years, there's a global survey. And this last one was done in 2021. And these surveys are very important for countries to take stock of their work on climate change. And they're useful to make decisions on the implementations of the country policies and plans. There you're able to identify what your gaps are in terms of evidence and also the barriers for achieving the adaptation and resilience priorities that you have. Now, there's going to be a new one coming out this year, and there will also have some additional focus on mitigation. So what is the health sector doing to reduce their own carbon footprint? So a lot comes out of the 26th conference of the parties, where there was an important health initiative in which it was agreed that for countries to start committing both on climate resilient health systems and on building sustainable low carbon health systems. And in a bit later in the year, UK and WHO launched what is called a very active now Alliance for Transformative Action on Climate and Health, better known as the ATTACH. And there's a lot of work going on in the ATTACH in these areas and others. But let me focus now on the presentation that I wanted for you to understand today, which is what we're doing with regards to health systems as a whole. And you may have seen this before. This is the operational framework for building climate resilient and low carbon health systems. And it's got 10 components based on 6 building blocks of health systems. So basically addressing leadership and governance, addressing the health workforce, addressing health information and evidence, addressing essential medical products, technologies, and service delivery, and importantly, finance. So these are the 6 building blocks from which we have these 10 components, and we're coming up now with indicators on both climate resilience and low carbon for this. So let me get a little bit on resilience. How do we understand resilience? So if you have, for example, a normal capacity of a health system, so it's functioning at its normal capacity, and you may have a stress. A stress is a slow event, such as a drought that is not perceived immediately, or you may have a shock, which is something like a hurricane. And what is important is that whether it's a stress or a shock, you will have a performance drop. So the facility or the system will drop considerably, or not so much, but it will drop. And then the worst case scenario is that for resilience is that the system may collapse. We would hope that it would recover to pre-event state, but hopefully it will be better than before or even transform so that this type of events will not affect the health system or the healthcare facility in question that we're addressing. So we have a similar scheme to understand what is low carbon in health systems and facilities. So people that do address mitigation, they speak of scopes, areas where you can work. You can work on an area that you control. You can work on an area that is strictly related to energy, or you can work in the supply chain, which is something that you control a lot less. In health systems, for example, you may control what you're doing in a health facility. You may control the energy that you buy or produce, but you may not control very much what is coming from outside, like where your products, your medical products are coming from. That is what we call the supply chain. And unfortunately, that's a very large fraction, 71% more or less of all the emissions come from sources that are hard to control. But how do we measure this? So you can measure the carbon footprint of the whole health system. This is a sort of top-down assessment, but it's a very difficult to do in many places. Many countries have not done this. You need a lot of data and well, a lot of capacity to do that. I think there's a few studies that have done this for countries. We found a study, for example, done it for 60 plus countries, but not every country, especially less developed countries, are not able to do that at the moment because of a lack of data availability. But what we can do is bottom-up assessments, which is measure the carbon footprint of health facilities. So this going now to the local level, one by one, adding them and coming up with an approximation of what would be the total health system, in this case, carbon emissions. So this is more or less the situation with data that we can find readily available for both health system performance and health system greenhouse gas emissions. As I said, only a few countries we have the overall information for the emissions. But as Matthias was explaining before, here we already start looking at the huge inequalities. As we know, climate change is by its nature a problem of inequalities, because you have countries, for example, in the Western Pacific, small islands that have emitted negligible amounts of greenhouse gases, and they are the ones suffering the most serious impacts. So we have the inequalities there. But we also have it in this figure. You have countries with very low greenhouse gas emissions, but at the same time, they have very low health system performance. Whereas in the top here, we have countries with very high emissions. We have very high health system performance. So what we really need to do, as the arrows show, we need to move everyone to a situation in which their emissions are low and the health system performance is high. And we hope that this can be achieved, at least from the greenhouse gas emission side, by 2050, but there's no reasons why it shouldn't be done by health system performance. So the question now is, how are we going to do to start measuring this? So here we come back to this framework, and its 10 components, and each of these components has 3 objectives. So what we have tried to do now is to develop indicators for each of these. So I'm going to give you just one example. I know we're very short on time, but if we take the example of climate transformative leadership and governance, we can have an overall component indicator for resilience, which could be policies and mechanisms for climate change and health established and implemented, as an example. But this would be composed of 3 sub-indicators, one on governance, one on policy development, and one on cross-sectoral collaboration, which are the sub-objectives of this component. So if we have indicators for each of these, we can lump them together and come up with an overall component indicator. Once we have all these components, the 10 component indicators, we can put them together and come up with an overall resilience index, which is what we aim to do. And this would be at the country or subnational level where possible. And we do something similar with greenhouse gas emissions indicators. In the example here is a GHG emissions reduction plan or a roadmap in the national health system is developed. So that would be the indicator. So we have prepared already the first draft of this, and it goes. We can measure this from the level of 0 to 100, or we can convert it to levels from 0 to 5. Level 1 being very low, level 5 being very high. Level 0 is that we have either no information or there's no action. And what we're doing for each of these, so we're looking at about 40 plus indicators, is to come up with the idea of putting the levels in each indicator so that users are able to very quickly assess where they are. So if the indicator is a climate change and health unit being designated by the Ministry of Health, the lowest level is that there's nothing available, and you can go through this graduation, going to the highest level in which there's a climate change unit which is fully funded, fully functional, and can implement its mandate. We can do the same for an indicator on greenhouse gas emissions. For example, GHG emission reduction plan or roadmap in the national health system has been developed, and the lowest level will be no emission plan exists or is in place, all the way up to action is being taken on all components and emission reduction plans or roadmap. So what are we doing next? So this is because it's linked to what the mandate of the GPW14. We need to come up with indicators on climate resilience and low carbon health systems. We are preparing this first version, which will be sent to revisions by experts, and there's going to be a phase of pilot testing in countries, in different regions, and then a preparation of a guidance documents with the final proposed indicators, and then release for use by country. So this is where we are at the moment. And Rocco, I hope I use my time wisely, because I know we're running out of time. So I'll leave it here, and thank you very much.
Thank you very much, Carlos. Excellent presentation. It's actually ongoing work. And maybe you heard GPW14, and you may be wondering what it means. It is actually WHO's long midterm plan, strategy plan. That full name is a General Program of Work. 14th. So usually 6 months, every 6 years, WHO set up new strategy plan. Now it is 14th plan, but it will be 4 years from next year until 2028. So in each program, they set up priorities and some indicators, outcomes indicators, and even budget. Budget allocation plan and so on. So it was adopted just in May at the World Health Assembly, and climate change and health is one of the 6 outcomes, actually the first one. So you can see how WHO is taking climate change seriously. So your meeting today is very, very timely. I'm so proud and so glad that my home country is actually completely aligned with the global trends, embracing climate change and health as a top priority of general health and also environmental health. So thank you so much, all the speakers again. We have 10 minutes for questions and answers and some discussions. And basically, we want to learn as many lessons as possible and as useful recommendations as possible from our speakers who have enormous experience in many countries in the capacity of WHO staff and also consultant. So we have 10 minutes. May I invite questions and comments from the floor? Okay, please, in the middle.
Thank you so much for all the awesome presentations for presenters. I have a question regarding some health-based standards. So I was wondering if there is any ongoing discussions regarding age group specific standards. So for example, children, elderly people are both vulnerable, but they the targeting diseases might be different based on their age. So I was wondering if there are any ongoing discussions about age-specific disease related targets or standards.
Is the question to Dr. Enke? Or?
Yes, sorry.
Thank you for the question. Yeah, for the WHO standards, the health-based the norms are very based on very thorough review, systematic reviews. So there is not necessarily age or stratified recommendation, but it's more the guideline values are based on the lowest impact on human health, including the impact on elderly and children. For example, if you think about the air quality guidelines, it's very thorough process. And it not only, for example, first of all, for the air quality guidelines, there is no safe limit because even the low level of air pollution has impact on human health, including for elderly and children. Yes, that's why it's very when these targets, for example, the PM 2.5 and other pollutants, they consider all the specification effects on vulnerable people. You know, and also, for example, of water quality related guidelines, this is the same. It's based on the base knowledge and available evidence on health effects of air quality, for example, water quality. And when we talk about health effects, we really shouldn't talk about, of course, it's very important to address the health issue for vulnerable people, elderly, but these are applicable for all population groups.
Thank you.
Yeah, thank you. More questions, comments, please? Yeah, while waiting for any comments, may I add a few response to the excellent question, how WHO guidance is addressing specific vulnerable groups like children, adults, people with a disability or underlying diseases. I have been working in the science division of WHO in the past 4 years before I retire. So I know how WHO develops a guidance, so they call it guideline, from the scientific evidence. So as Matthias explained so well, equality and equity is a key value, very important value of public health work. So from the start, when we collect evidence, when WHO collects evidence, they try to understand this different distribution of disease and exposure risks by different social categories. Matthias explained very well with income and other 1, 2, 3, 4, 5, these social kind of categories. And those evidence will be used in developing guidelines. So objective is to protect the most vulnerable population. So usually WHO guideline, when the threshold limit is, action limit is set up, that limit can protect most vulnerable people already. That's why WHO standards are usually very, very strict. And then, as you mentioned, it is also health-based. WHO does not see We don't care how much it will cost, how technically is it possible or not. That's a government responsibility, maybe business responsibility, scientist or engineers' responsibility. WHO cares about life, health, survival. So when we see any dose-response relationship between a certain exposure and the disease outcome, we cut from the first observable adverse effect level. You know, that's so-called risk assessment that is used. And in those risk assessment, vulnerable group, more sensitive people are considered. And these dimensions are addressed in most of WHO guidelines. So my job was to manage the quality of WHO guideline. So when a program develops a water quality guideline, for example, or air quality guideline, and we find no mention about vulnerable people, no mention about existing kind of underlying disease and so on, we return it. And then they have to address it. So that's kind of quality control. This has become more and more strict. That's a bad news for many WHO staff. However, that's good news for the vulnerable people. So I am very proud that WHO is providing guidance considering equity issue, gender issue, and any vulnerable population issue. Thank you. Any comments and questions, please? Maybe then we can close the session. Let me share my own observation, also my own lesson. As I mentioned, I started my work in WHO 20 years ago in this area. So now 20 years later, I feel I learned something as well. I told you why European countries have such a concern about equality, when their social equality is quite okay already. At the same time, why European WHO regional office started environmental health movement already 1988, many years ago. Why? Because environmental health was so bad, environmental pollution was so bad in Europe? No, it was quite good already. But still, they cared about environmental health, and what we discussed from the morning all the way today, most of discussions were already in the European region, and Carlos Covalan from headquarters and all those colleagues today here were part of that process. Why Europe, or WHO is their job, but why Europe was more keen on this topic? And can we learn something from it? Anyone can comment on it? Okay, I don't have answer. Actually, it's irony. That's what I learned, the irony. When the equity is the best in one country, they are most concerned about equity. When women gender equality is the best, like Norway, Sweden, their top social priority is gender equality still. Why? I couldn't answer, but I tried to learn working in Europe for almost 10 years. My lesson is, my observation is, let's turn around the cause and effect. Because they are concerned about gender equality, they already achieved that high level. Because they are concerned about environmental health, next generation, that's why their environmental health is so good. They care about equality, solidarity so much. That's why still they are thinking about health equity, when everybody, like in Germany, higher education, college, university, all free. Still, they take, as Matthias nicely explained, equality is still top issue. So what I learned from this interesting phenomenon was, it's not what things are going on outside that leads the world. It's your idea, it's your value. If you don't care about equality from the start, equality is so bad, maybe there's a revolution, like the French Revolution, they don't care, and then it happens. That's maybe 17th, 18th century, 19th century that happened. Probably Europe learned from it. They had important lesson from previous, maybe, centuries, so they don't want to have another revolution, another bloody social conflict or war. Maybe that's why. And they are taking care of equality so much, and they achieved this level and going on. That's my lesson, actually. So we can also do similar work in your area. So rather than waiting until something is better and then we can do, no. If you think something is right, something should be done, do it now. And then you can improve the situation. And the wind is your side. Climate change, environmental health will be more and more important in the coming years. So in a way, the country and people depend on your ambition, your devotion. That was my own lesson. Maybe I'm wrong, but let's see. Okay? Okay, Rick. Sorry, I missed, I didn't see you. Rick, please comment.
Thanks, Rocco. No, I was just enjoying your discussion about concerns about equality and inequities. And I think in some ways, it's easier to be concerned about inequalities when the overall average is quite high. For any indicator, I think, if you're only at 50% level, the policies are really focused on just increasing services for whatever it is, and not so much on are the poorest also gaining access, and maybe even when you're at a low level service, the priorities might be to get services first to the richest and to the urban settings. But once 90%, 95% coverage is reached, then you can say, oh, but not everyone is enjoying this high level of service that we are now accustomed to. And who is being left behind? And it's easier in a way to focus on rural areas. You mentioned Germany. Small systems in Germany still face challenges, and there's a lot of interest in bringing the level of service up in those small, vulnerable areas to the level that's accustomed to in the majority populations. But I also take your point that we shouldn't wait until most people have good services to think about addressing the more vulnerable. And I think maybe the issue of climate resilience is one area in particular where we need to be focusing from the beginning on who the most vulnerable populations are. And that might be people living in low-lying areas where flooding is more of a risk. It might be the elderly people who we know are more vulnerable to heat, to extremes of heat that they'll face. So I think it's good to have this focus on inequalities in the most vulnerable populations, even before we solve the problem for the majority of the population.
Thank you very much, Rick. Excellent comment. Yeah, that reminds me of a slide that Matthias showed, two approaches. When the average status is quite good, we just improve general average. I mean, equity is already there. If the situation is not very good, also very diverse, we try to protect the vulnerable group first, and later equality. Matthias, would you please add? That was my understanding. I was very impressed at that approach. Thanks.
Yes, I think that slide showed, and that was also the purpose of it, that having this information on how a certain situation or environmental condition is spread across the population is extremely helpful to decide whether you go, as Rick has mentioned, for a more targeted approach, being informed about who and where you need to invest more, versus going still for universal approaches, trying to improve the conditions basically across the whole country and for all population groups. However, I would like to say it is, following what Rick said, of course, a given that the more you are able as a country to reduce environmental risk exposure for, let's say, air pollution, when you bring it down from 20 to 10 to 5%, then of course it will be getting more and more relevant to ask who are those 5% in the average exactly in the population, because it's very unlikely that these are 5% of the rich and 5% of the poor, or 5% in urban and in rural areas. So the more you are successful in bringing down the average, the more important the question becomes, who are those people that are still not served well? But I think we need to also, as a discussion show, we need to start early, because you should not automatically assume if you are still at 30% of exposure for the whole population, that then this is something that affects all population groups more or less equally. So breaking down and stratifying might also give you some surprises that 30% on average might still be very much for vulnerable groups and very little for high income or fortunate groups in a society. And then the average may suggest do action for all, but you still would have a very strong cue that you do need to target that. And I think one of the slides I also showed where most people would expect that poor households in rural settings are more affected for WASH and other things. Some countries have the opposite, and they have an urban stigma. They have the urban poor that are much more disadvantaged in some areas, and it is different by country, and you really need to know. So the average might be one element of decision making, but I do think you, at an early point, need to also have an understanding of the distribution, and it might lead you in different ways that you would not expect in the beginning, and certainly in some countries.
Thank you, Matthias. Before we close, if there is no more questions, may I invite Carlos' remark, because you are dealing with the most challenging, also new kind of overarching threat to global health, and covering also health system issue, which is a reality of in many countries. And with your environmental health kind of leadership in the past decades, and also this deep sea approach, which allowed us to adopt a broad-based approach from driver to actions. What would be your kind of a perspective or expectation of future of climate and environmental health indicators, and also our work in general? Thank you.
Yes, thank you, Rocco. You mentioned that the deep sea framework was discussed. I was not participating, but I was wondering whether anyone used this scheme that we developed for the Ministry of Health, New South Wales team, and because it's got the important addition to the original framework of vulnerability and social capacity. So here what you
Carlos,
have
just a
is
moment.
a filter.
We cannot share the slide. Can someone help?
Oh, I'm sorry.
Slide can be shown. It's not displayed. Thank you.
Yeah, so
okay, we'll
I'm not
fix
too
it.
sure whether anyone used this, which has been published maybe 5 years ago.
Yeah,
but
thank you.
What is important here is the important addition of vulnerability, because this is sort of the filter in which we'll determine the health impacts of climate change. So again, we have the issue of inequality. We have climate change as a global issue, as an issue where every single person in the world may be exposed to it, but in very different ways, and not everybody in the same way will have the same impact. So the issue of understanding vulnerability is key. And from this point of view, the person has developed guidance on assessing vulnerability and adaptation to climate change. So as mentioned earlier and mentioned by several of you, climate change has the potential of being impacting so many of the other environmental risk factors, whether it's air pollution, whether it's quality of waters, whether it's linked to extreme climate events, and there will be always an impact on which is differential on different community groups. So this is why this is so important, this issue we're discussing of inequalities. And Matthias, your presentation was very illuminating in this sense. I think we're not there yet with climate change indicators to do that type of analysis, but I think you're pointing to something that we need to be thinking of in the future. Thank you very much.
Thank you, Carlos. So with that, I close this session. Thank you very much for the speakers, for your excellent presentations and discussions. And also thank you very much for the audience for your active participation. Thank you. Thank you, Anke.
Thank you very much. Thank you all the speakers, Dr. Local Kim. We are now approaching the end of our symposium. The final session of wrapping up today's valuable discussion will be led by Dr. Yun-Chul Hong. Please welcome Dr. Yun-Chul Hong again. Dr. Milan, please come forward and have a seat.
Okay, thank you. So we are now in the last segment of the symposium, and I think that this is really a wonderful symposium, much better than I expected when I designed this symposium. And actually this is kind of the last segment to conclude of the symposium, but now I feel that this is overwhelming. So it's not easy to conclude this symposium. We started from the environmental health indicators, but now actually finally talking more on inequity. So it's a kind of a really broad coverage of the environmental issues as a whole. So actually we talked about air pollution and the water sanitation, and the waste management, climate change, and the inequality. And in the aspect of a scale, we talked about the global and country, and also local, provincial. So it's a lot of issues. I found that I realized that indicators are really kind of very important nexus to link everything about environment and health, from the driving force to action. So this is a really important topic. So now I think it's not easy to conclude today. So I think I'd like to invite the panels now and the panels online to share your ideas. What would be the following action for us from this symposium? And what would be your suggestion for action for us to do? So what is your idea of which item we need to emphasize more in the future for better health, for better environment, to tackle against serious issues, climate change or other environmental hazards to come in the future. So I would like to invite your thoughts, your ideas, or plans, or suggestions, whatever. Who is going to be the first? Miran? All right, first, okay. Who would be the first online? Okay, Richard. Please.
Thanks so much. I think we've had a lot of interesting discussion about the importance of inequalities and considering the most vulnerable populations. So there's definitely something around recognizing who's not already benefiting or who might be left behind from whatever initiatives are taken. And I think that implies work at a very local level. If you are focused really on the national statistics or even the district level figures, you won't always find those hopefully small populations who are the most vulnerable. So I think you need the really tricky thing, which is the combination of an agreed strategy and indicators at a central level, but action at a local level to implement those, to both measure who is not already being reached and to have targeted interventions to reach those who aren't, who are the most vulnerable. So it's a very tricky thing actually to have this combination of agreeing a central level approach and implementing it at the local levels. But I think that's the way that we need to be thinking going forward.
Okay, that is a fantastic suggestion. Actually, we have an approach on the central level, and also we have a little different approach on the local levels. So, good suggestions. I would like to invite another. Okay, Matthias, please.
Yes, thank you. I think I would very much connect to what Rick has said before. My main point or takeaway or suggestion for further work in WebRope would be to enable data for stratification. I hope that I've been clearly showing how important it is to be able to stratify in order to understand distribution on inequalities. But one of the main challenges we face is that a lot of environmental data cannot be easily stratified. So I think one of the most important steps to better understand the situation and to have better evidence for decision making would be to embed and integrate social determinants and other determinants like information on education, income, location and residence, sex, ethnicity, whatever you are mostly interested in, to embed that in surveys and monitoring system. And that would also include what Rick has said, information to go down from a national survey to local areas, down to neighborhoods if possible. Some countries have utilized postcodes at a very small scale, so they can break down this data either on individuals or very small areas. And that is extremely important to use this data not only for the average and a general understanding, but also to drill down on the distribution, on the equity. But a lot of survey and monitoring tools, a lot of surveillance mechanisms do not adequately embed this dimension. And then, of course, you cannot break down the data afterwards, and you cannot check on equity. So my suggestion would be to see how can we better embed these determinants that we need for stratifying and assessing environmental inequalities. How can we embed them in the survey tools so we do have data that enables this equity assessment? And that, I think, would be a huge step to enable information, awareness, and evidence for action.
Okay, thank you very much. Another very good suggestion, and good data acquisition and the data stratification from the central level also to the local level. Thank you very much. The other suggestion? Ivan?
Thank you. I would agree with the two previous points and add that those points lead to a suggestion of developing and evolving indicators with new data and new questions. And I think that's a really important aspect of indicators. Not only do they have to be standardized, and there needs to be a consensus and a centrally kind of mandated style, they also have to be flexible to local needs and needs that are novel with new threats. So I really commend the standardization of the framework and agreeing that something like this latest version of the deep sea is a standard, but not getting too hung up on the definition of a particular set of indicators and only those indicators, but being flexible to evolve and develop them with a discussion and a debate with new evidence.
Okay, thank you very much. Standardization and also flexibility to the local context. That is also a very important aspect. Dr. Kobaran?
Yes, thank you. There's several issues here. One is that when you think of indicators, comes from the Latin indicare, which means to point. So you're pointing at something.
Mm-hmm.
And you want to point at something that you can act on. And you also want to point at something that we may not know that it exists. So for example, we're not measuring something, it doesn't mean that it's not a problem. It's just that we haven't yet agreed on how to measure it or discovered that we need to measure something. So this has been the issue with climate change, in which we are ongoing discovering what things need to be measured and addressed. When it comes to indicators in general, we often think that you need to focus on the area where decisions are made. So this calls a lot for local level indicators, where local decision makers can see what the problems are and can find ways to address them. But I think that indicators really need to be both measured and displayed in a way that promotes action, easily understandable indicators that promote action. So sometimes for us, it's very easy to look and immediately understand an equiplot, which is an excellent form to show inequalities, but a decision maker may need a lot more explanation to really point to see where exactly your problem is. In climate change, we are focusing a lot on addressing vulnerabilities, which brings the topic of indicators to a more broader, just environment, but where is the social environment in all this? What are your social vulnerabilities, your political vulnerabilities, your own economic, biological, and even geographical differences in the communities, and therefore that affects your vulnerability. So this also brings into the issue of inequalities. So having said that, I think that the short time that I was able to participate in this event was I learned a lot. I find it really excellent, and thank you very much.
Thank you very much. So indicated kind of really pointing to the point we need to solve. So thank you very much. So I also invite. Okay, please.
네, 제가 한국말로 한 말씀 드리고 싶어요. So I will speak in Korean. So environmental health indicators at a local level, developing them and using them, of course, in and of itself is very important. But the ultimate goal is by calculating indicators to understand what problems there are at a local level and to come up with a policy. So it informs the policy process and improves the overall health conditions of citizens. So for Seoul metropolitan government, it's about contributing to better health outcomes for the citizens. That would be the ultimate goal. Now for local governments to do this, so the most fundamental issue would be having the right governance. As I mentioned before in my presentation, our environmental health plan, there's a citizen health bureau that is leading the process, and climate change and air pollution that is actually handled by a different bureau that is responsible for climate and environment. So from 2017 and 18 or so, we've been proposing this idea, but then it is done separately by different divisions and bureaus. Because environment and health, it's not only an issue for the citizen bureau. So we work in consultation with the Climate Environment Bureau. So in the implementation process, we would have to, for example, work collaboratively across divisions, and we would have to go through the buy-in process and go through the consultation and collaboration process so that we can ultimately develop the target and we could actually achieve the original intent of that process.
Bring to set local environmental health indicators with many people in the local distriction. So because even though we set a very ideal the science-based indicators to suggest if the administration bodies in the local government do not accept that, nothing happens. So that's why we need to persuade them why this is important, why we need to take this one. So it's kind of a struggle among the engaged bodies in the local government and with another interesting party in the area. So thank you very much. That is a really good point.
I think Professor Hong has given us a really daunting task of trying to wrap up this session in a sort of a more how to establish local environmental health indicators in a country where environmental health, the concept of environmental health to local administrators can be an issue to convince. We're dealing with local governments where one person might be dealing with climate, environment, resource, everything. And now they are thinking about environmental health where traditionally they were thinking of environment versus health in a two different entity. And I think one of the biggest challenges that we have to think about is to disseminate the idea of environmental health at a local level, a consensus definition that everybody can agree upon. And I think that's the first step that we're doing right now, is the first regional or local environmental health master plan is being developed and being implemented. And it's only the second year of the implementation of the plan. And I think we need to think about what trial and errors we're going to have
to be able to figure out what are the vulnerable populations in each region, what are the most important environmental health challenges in each region, and what the local governments can do to overcome these challenges and to provide for the safety of these vulnerable populations. And therefore, I think for me, the take-home message for this symposium might be that we need to get a consensus among the local governments on what are the important directions for the policies of environmental health. And then they can probably, or most likely, understand why the indicators are important, why the administrative indicators are not, why not just the administrative indicators, but also environment and health indicators are part of the environmental health indicators. Because I think I had a very difficult time convincing people why environmental media indicators are part of the environmental health indicators. And the reason was that the concept is still not understood by a lot of these people.
Right. So that's why we have this symposium to tackle such difficulties, to make some kind of approach, good approach. But actually, one of the conclusions we had today, this symposium is we should take a consensus-based approach when we set local environmental indicators. But the problem is making consensus is really a difficult task because many different interest bodies in the local government do not have easy conclusion to make decision. So that's why it's not easy a task. So that's why I think we don't have to be very ambitious when we set local environmental health indicators. I think it's okay to take a baby step first. So now you are doing 2 years, right? So we are also doing 3 years about local environmental health indicators, but we realize that we should not be very ambitious. We should take a right approach based on consensus, based on science evidence. So that is what we need to take. That is actually a lesson from the 2 years or 3 years experience. So please, amen.
Thank you. Yeah. Carlos pointed out that we are talking about indicators. Indicators is not substance itself. It is pointing, kind of directing, drawing attention to some problem. One Korean wisdom word: don't see the finger when someone is pointing the moon, right? Don't pay too much attention to the finger when you are pointing the moon, at the moon. I think that applies to these indicators as well. We have to work hard. You have been working so hard to develop indicators in your local government. It's important. So, but what is it for? What are they for? To point out, yeah, whether the situation is bad or good, improving or not. That means you have to understand these indicators in the context of time, your area, maybe politics, maybe money, budget, local economy, business, local public opinion, everything. In that context, you are pointing out that issue. And that's something I really want to remind you. If you, what you have been doing is developing a set of indicators, wonderful. All the evidence and the good reference and publish maybe every few months, fact sheet. And after that, if that is the end of the loop, please, you have to think about it. What are they for? You are doing only looking at the finger, not the moon. When those fact sheet and reports are communicated with your boss, mayor or governor, or maybe minister, and local newspaper, local NGO, maybe local leaders, local church leaders, or whoever involved or affected, if they are used in the context, and eventually, thanks to that indicator, those fact sheet and communication, there is some action by your boss or by some decision maker or local people. That is the context, the whole loop. So that's why when I first heard about indicators, it's only half job. The other half is whole system. And in I think Matthias, you know very well, in the European region, we didn't call environmental health indicators project. We called it environmental health information system. Information system. Indicator is only one of the tools in the information system. But I understand we are in that stage of developing information system, full climate and environmental health information system. And first step is indicators, but let's not forget that overall direction, that we are pointing out something, the moon, and not the finger itself. Thank you.
Okay, thank you very much. So indicators is not just indicator, it's about the system. Probably more than information system, the really whole environmental system. So because of time constraint, I'd like to wrap up this session. But before that, before going to wrapping up, I'd like to share our plan. Because today we had a very much successful symposium, but we also understand it's not easy to conclude now about what would be the local environmental indicator, what would be the best approach. Here we need to talk more. So we will have another symposium in November 12 or 13. That would be following symposium based on today's talk. So that the symposium is nested in a World Health City Forum held in Incheon. So we will announce the plan later about the next symposium following today's talk. So that is our plan. And now I'd like to invite two people who are representing organizers of the symposium. The first is Rachel Iran.
Great. Thank you very much, Professor Hong, and thank you very much, the audience, for being here and for staying until so late. I think a quick word about the day, just to summarize our guests, our invitees, our hosts, our partners, the organizers on behalf of ACE, of the head of office, Sakim Ali, of our coordinator, Inge here. We have a team at the back who's really been excellent, the World Health City Forum team. I think my takeaway from the day, in addition to saying thank you to everybody, has been that we split the day into three big parts. Starting by understanding what's happening in different countries. We reviewed Australia, Singapore, Japan. We had a very nice presentation on the Korean process. And then we really got into the city level, local needs. What are municipalities doing? What are their requests? How are they operationalizing these very high-level national indicators? And then we ended with that excellent panel looking at the thematic areas. As a closing word, maybe I can just mention the three main things and then three main solutions for us as we go forward as partners and as collaborators. The first is that I think three things. There's too many indicators. Second is that it's very difficult for countries to actually abide to many of those indicators. We mentioned the air quality ones, but we have a whole range of climate change indicators, WASH indicators that are still very challenging to respond. I thank the panelists for raising GMP or GLASS surveys. Each of these surveys can cost countries up to $30,000 to do a survey. So yeah, too many indicators, very costly. And then the last point is we talk a lot about quantitative indicators, but most of the work to get the quantitative indicators done and dusted is to do qualitative work. And doing both consultation and modeling, they're very complex skills, and I think today we covered that with the panelists. Moving on to solutions, I think WHO is very honored to see the Republic of Korea, but also Seoul Metropolitan Government, kind of taking the lead on consulting, exchanging, sharing with different countries, and we're very happy to share more resources and guidance. But in the end, a lot of the work is being done at country level, and I really wanted to commend that on behalf of our team, and thank you very much. A big clap to you all.
Okay, thank you very much, Miran. So we will have a final comment, reflection and comment from the Ministry of Environment Korea, which is responsible for preparing environmental health indicators in Korea. So, the Director.
안녕하세요. 다시 또 마이크.
Hello, so I got the microphone back, so thank you. And I do not believe that there's much more for me to add because I have listened to such good comments so far. And it's just that there is the saying that we need to make sure that whatever we do, we need to make sure that the benefits go to the most vulnerable. Right, so for over 10 years, we have been working on the environmental health indicators and also publishing reports. But then now, what we have realized is that, of course, there are so many indicators, and of course, each and every indicator is important, but perhaps more than anything, as Professor Hong has mentioned as well. So we see that, yes, there are so many different indicators, so many different factors, and they create a nexus to create the health outcome for individuals. So, and also, Dr. Kim also has mentioned this, but then again, this is the result of a comprehensive set of factors that result in the health and environmental outcome of certain groups. Then based on that, then what can the central government can do, and also what are the actions or the measures that we can take. And in some cases, it is very difficult for us to determine the causality. Then for certain groups, for certain classes, then what do we need to do is one of the biggest questions for us. And another question is, now of course, climate change is also part of the environment, so we actually see them all together as environment. Then let's say for new environmental threats, because there are always newly emerging environmental threats. So in Korean, we call it potential environmental threat factors. Then also for them, together with the other experts and also together with the international organizations, we'll continue to work together by sharing information and data. Thank you very much.
Now it's really time to close. I'd like to thank you all of the panel, online and offline, all of you. Thank you again. So I'd like to give a microphone.
Thank you all the participants. That concludes our symposium today. We will delve deeper into the topics discussed today at the second World Health City Forum that Professor Hong mentioned, which will be happening from 12th to the 14th November at Songdo Convention in Incheon. So we will send out more detailed information to all the participants today. So if you have any question about the event and further symposium, please contact World Health City Forum or the Environmental Health Center. Thank you again. We are really grateful for your participation and look forward to further collaborations in the future. Thank you very much.